What's that?
Mike's son.
No, that's why that one was
I'm
because I
gonna put your
figured you
arm work
probably
out.
got, that's why I was kind of like with you. Yeah, you know what I'm saying? Hey, what's going on, everybody? How y'all doing? Oh, look at that cast up there. That cast is beautiful. Listen, how's everybody doing? We got some people in the room already building. Hey, I do apologize. I just wanted to make sure everything was right with the vocals and all that stuff like that. So it's all on me as usual. My thing. I have one of those shows that's never gonna start on time. You know that because because it's just who I am. But I'm gonna start it off like this right here. This month, of course, is Mental Health Awareness Month, as well as Better Speech and Hearing Month. You saw Kenzie about to jump on me because everything getting right. And so what happened was the whole point when we started this month, and boy, did the month go by fast. My thing was I didn't want to just highlight it on the first week because I had Leah from Leah Sons Counseling Services of Houston. She came in, she started everything off. I didn't want to just hit it with one day. It's something that we should talk about all year. But I said, you know what I'm going to do on my platform, I was going to make sure that at the end of the month, I had a roundtable discussion with brought some professionals in, as well as one of the professionals' daughter, so we can get that perspective as well. And we got little man over here. He's going to give us his perspective. And so that's going to be a great thing tonight. But I'm gonna start off with I have a special guest in the building. I have Dr. Ann. If you've looked at my Instagram, you can see who she is and what she does. You can go to her website. But Dr. Ann, I want to tell you, I'm so thankful that you were able to join us tonight. You know what I'm saying, from the lovely country over there in Spain, because I love her and I love the scenery that she puts up on Instagram. It keeps me motivated, reminds me of many times I've been to Spain, and it just makes me happy. So I'm going to start off with you, Dr. Ann. If you could introduce yourself, and then we'll go through the room. Good morning, Dr. Ann.
Okay, morning, and thanks very much for inviting me. Yeah, it's 20 to 3 a.m., so I might not be at my brightest at this moment in time. So I'm a psychologist with years experience, and I now specialize in working with clients who have anxiety and relationship issues. Often my clients have come from a background of quite a disrupted childhood, where they've experienced some level of trauma, and now what they find is it's impacting on their present day life, and especially they deal with intimate relationships. So I take them through a process of dealing with the past hurt and dealing with their current situation and moving on to them having a future of happier, healthier relationships.
Okay, thank you for that wonderful introduction. I mean, we're looking forward to really say getting the meat and potatoes, exactly what you do. How long have you been doing what you do?
Have I got a delay? There's always a delay in Spain with the Wi-Fi.
Mm-hmm.
30 years. I actually started when I was 18, going to university. But I actually started, I use hypnotherapy, and I actually began learning hypnotherapy when I was 14. So I'm now 40. You can work out the math stuff, but it's quite a while.
Oh, okay. We'll make sure we keep the connection going. So if I start from my left here, right here, I have a lovely young lady here. Could you tell us who you are?
Yes. My name is Anna Perry. I'm 22 years old. I've lived in Houston, Texas for about 5 years.
Okay.
I'm a military baby. My mom is right next to me on my left.
All right.
I've lost you.
But basically what I do is
Oh, it's probably delayed a little bit.
Okay.
You go ahead.
What I do is I model. I also do trading and I do marketing with my mom. That's pretty much all I do.
Okay, got them shout out there. Don't say that's pretty much all you do. You do a whole bunch of stuff.
I do a bunch of stuff.
Don't try to act like you don't do nothing. That's what you ain't gonna do. Okay, who's this professional we have over here? To your left, who is this?
That's my mother. She will introduce herself. Her title goes on and on and on. So
okay, but we hear from one title tonight. You know what I'm saying?
She's a PA. She's a physician assistant.
I'm sorry. I was asking her. I'm sorry. My bad.
I thought I was passing.
No.
There you go.
It's all good. It's all good.
I am Brandy Renee Tapp.
Okay.
And I am a retired Air Force veteran. I in the Air Force started out in primary care, and so I am here to give that insight as a primary care provider and what we see from a first line standpoint with patients, where we identify any kind of issues with anxiety, depression, suicidal or even homicidal ideation, things like that. And so I'm just here to give that perspective, and very happy to have my daughter here on the panel with us. And thank you, G5, for inviting me back. All
right. And who do we have down there on the end down there?
All right, now you get on me every time about this mic.
Yeah, you got to pull it to you. They already saying they're doing this right here.
No. Okay, is that a little better?
You say your first two guests keep doing this right here. What's the comments?
I'll make sure to stay
you can just
straightforward.
Or just take it out. Just take it out. That's fine.
No.
Oh, you sure?
No.
Okay.
So Monique Conway, I am a clinical addiction specialist.
Mm-hmm.
I have my master's in social work and my licensed clinical social work associate's license and licensed clinical addiction specialist associate license.
Okay. All right.
So my primary population has been those in reentry. So people who have been formerly incarcerated, formerly justice involved. I've been working with that population a little over 10 years now.
Okay.
And substance use. And I kind of bring that bridge between the two. We often find that those who are in the reentry population and those who are formerly incarcerated typically have higher incidence of substance, not quite use, but substance charges.
Right.
And how that relates to, later use and the impact that has. So that is pretty much my population and where in the frame with which I speak, as well as medication assisted treatment.
Okay.
So I have a lot of years of experience working with folks on methadone and Suboxone. So we get to have fun with that.
Okay. Well, that's good. That's good. All right, Mr. Hugo.
Hugo V. Life is wonderful.love. That is the community. I have been an addict for over 20 years, compulsive gambler, alcoholic, but I've also been in recovery for over 20 years. So I've seen the gamut of how you slowly progress as well as how you get out. And it is a process. And in the end, it's just talking about the gift of help.
Okay.
But there's so much help out there. And that's kind of like what brought us all here together is to share that there's a bunch of professionals as well as people who've gone before you that can kind of get you out of your current situation so you can live your best life and that you can believe that you are a miracle.
Right.
Not only a miracle of recovery, a miracle of life.
Okay. All right. Okay. Looking forward to hearing some more about that. This is going to be a great conversation tonight. I'm telling y'all, because I got some stuff that's going to come in. I got some questions. You know what I'm saying? I need to know. And who would I have on my right here?
Hi, I am Kenzie.
Shout out for the yellow dress. I better go check episode. I don't know what number it was, but she had this yellow dress on. I just want to put that out there. And I got the yellow button too.
Can I go now?
Yeah, go ahead.
Okay. So I am Kenzie Gray, board certified speech language pathologist, special needs advocate, and autism specialist. A graduate of the Southern University and A&M College.
She had to say it.
And a member of the Distinguished Kappa Alpha Sorority Incorporated.
That's what she said, man. Oh, you ain't had to come behind that?
That's it.
Oh, okay. I'm so. Yeah, squeeze and all this stuff. Anyway, all right. So
I think we need a G5 introduction.
Listen, this is G5. It don't even matter. I don't do nothing. I'm a country boy from North Carolina. That's it. You know what I'm saying? I got $2. I've been trying to make that $2, $3 for the last, I don't know how many years. And this is what I'm doing.
Oh,
You
This
did
is how I'm
try.
doing.
You
I
did.
tried. I
You did.
tried.
Yeah, you know. But anyway, so hey, I'm ready to get down to the nitty gritty. The nitty gritty. Okay. I'm gonna bring up some things, and I just need you guys to talk as professionals because my goal, my thing for me, I want to hear what professionals talk about to each other. That's not from the same exact field. You feel what I'm saying? You know, and I'm telling you right now, I got exclusive. You know what I'm saying? Y'all better stop playing. I got exclusive right now. Y'all know who I got in Spain on the books right now? Y'all know who? You what? Come on now. I got the Dr. Ann in the building. So ain't nobody get Dr. Ann up at there on 2:30 in the morning. It's 2:49 in the morning, Spain time, and Firecast got her up. You know what I'm saying? I don't know. It's probably frozen inside, but I can see her. I can see her actual movements. The TV is showing delayed, but I see it. She's smiling. She's grinning so hard right now. Look at her. She all cute. She got them cute dimples too. Hey, Dr. Ann, you got them cute dimples too, girl. Gonna tell you, dimples is hitting. I don't know if anybody told you yet in Spain yet. Let me ride by Spain and see them dimples out there. But anyway, that's another subject. But check this out. So I'm gonna tell you from my community, right? I told y'all, you know, my little hood baby. All right. When it comes to counseling, seeking help, anything of that magnitude, right? It's always been a problem, a stigma, an issue. And what happens is these people grow up and they're grown up now. You know what I'm saying? I'm talking about people from my year group. And I think now they want help, but they still scared to go get help because they don't want to be seen as weak. Some of these people are real big business people, and they need help. What is it that you guys still see that is an issue? And I want you to answer from all. I want it to be a conversation. It's not like waiting for one person. No, I want it to be a conversation on the table and y'all talk about it. You know what I'm saying? You know, why do you think it's still an issue, and what do we need to do?
It's ego. It's ego.
You think it's ego?
Yeah. I think that's the biggest thing that gets in the way, especially when you're an adult. I feel like it develops. It develops as you get older. It's your ego. And that's what I think gets in the way of a lot of people seeking for help and a lot of people wanting to get help is that they think that they're too professional or too much of a leader in order to go down to the point where they're very vulnerable and they have to talk about the things that they don't want to talk about.
Yeah, I mean, and we have this entire culture that teaches you have to be strong. There's no such thing as that ability to have a breakdown, or like you're saying, or you're weak. Or if we have this moment where, yeah, today I'm not okay. Oh no, you need to get back okay as soon as possible because not being okay is not acceptable. And we keep that drive in these communities and then try to come back and say, well, why didn't you get some help? Well, you told me I wasn't allowed.
Or it's what's in our family.
Yeah, you owe me.
You know, you don't share your family business. You know what I mean? And so I think that's something that's a lot of people as well. So, you know I would see people and they would come in and if they came in with someone, whether it was a spouse or a family member, they were less likely to divulge any issues that they have. But if you got with them one-on-one, and I know being in the military, when she turned 13 and they start having those, okay, mom, I need you to step out the room moments. I think we need
you gotta stay on the mic, Brandy.
Well,
you just take it out and hold it. Yeah, because you keep turning your head. And the people can't hear you. They talk.
Okay,
they tell
sorry.
them.
So I think that if we have those moments where we do as providers have those one-on-one moments, it's a little bit easier for people to divulge because sometimes you're less likely to share when you're in a group setting, especially if the person is with you who is perpetuating that idea to say, what's our business is our business and you shouldn't share.
But I'll tell you, actually, if people would stop assuming things, the definition of courage is actually emotional vulnerability. If you actually want to grow, because I tell people, you have to almost ask the question from the flip side: what type of life do you want? Everyone's going to say, "I want the best life." You can only live your best life if you're emotionally vulnerable. True courage is emotionally vulnerable. And I've done a lot of these kind of like videos and stuff. And I tell people really one of the things that really keeps people is rejection. Because if I really told you who I was, you might not love me. You might not like me. And here's the thing is if someone rejects you or says, I don't want to be your friend or be associated with, there's always somebody down the street that will be.
Mhm.
We almost got to jump off the cliff and realize that the world is so big and so full of love and acceptance and supportive that there is someone that will listen. We kind of talked like before this, I had a family that when I said I was going to go into therapy, they thought I was crazy. I said I was going to go to 12-step rooms. They thought I was crazy. You just got to pray more. I go, well, the Catholic Church has a lot of good in it, but it did not solve my emotional issues. I needed to see a therapist. I needed to see other alcoholics. I needed to be around other compulsive gamblers that were actually trying to do something different. But it really keeps us, we're so afraid and realize, and here, when I started my channel, I started talking about all types of subjects, about each of the 12 steps, each of these depression, anxiety, gratitude. And I started telling my story, the good stuff and the bad. Everyone else starts calling me up. People I hadn't heard from in a while, and they start telling me all their stuff. And I tell people that's the key. And then I start getting closer to a bunch of other people.
And I think, just to piggyback on what you said, Hugo, I think it's also an aspect of fear because it's not familiar. So when something is not familiar, we have natural fear that comes with that. And so there's like this sense of embarrassment from the culture. So that's a factor. And then there's also being scared of it because it's unknown. It's fear of the unknown. It's like, well, when I go and talk to this person and open up about this and that, what are they going to think of me? Are they going to judge me? Are they going to tell people my business? So I think all of those things factor into that as well.
I like that.
That's that whole piece with shame, though, right?
Yes.
Where just like you're talking about but just like what you're saying, that true courage is that emotional vulnerability. And everyone is so focused on shame and making sure to avoid shame instead of trying to turn shame around and make it something to where it actually is a strength of yours. My ability to be vulnerable is not a detriment to me. It's actually a strength.
Well, I can give you a different example. You ask a lot of guys, and they'll say they want to have great sexual experiences. And I will tell you this. Ask any woman what is the actual best sexual experiences for them is when they tell you that they are emotionally connected with their partner.
Absolutely.
And so, and all the women here are shaking their
Yeah,
heads. So
Agree.
here's the thing.
Agree.
So if guys actually want to be, you can almost like challenge it. You want to be better in bed. You want to have a better love life. Then become much more vulnerable. If you want that great experience, and even outside the bedroom, if you want to have a great relationship, be vulnerable. And women, and people are always afraid, well, women will think I'm weak. They're just going to say they want a masculine guy. A true masculine guy will share everything. And you know what?
Yes.
Preach.
Women are attracted to that.
Yes,
And now let the women talk. Talk about the men.
Yes, thank you.
Yellow button worthy.
Yes. And that's the people do not recognize, and especially men, they have that, well, I can't share that. I can't be this open. And whenever you ask why, well, I'm not supposed to. You're not supposed to know that.
Based on who?
Exactly.
And it's, where did that come from? Well,
told you that?
that's just, that's not how I was raised. Well, how did that work out? How did your parents' relationship work out by him being insistent on not being vulnerable or not being open and not having transparency? How did you see your grandparents' relationship work out when it's only that where it's transactional? It didn't go too well. Because now you're looking at, they stayed together 35 years. Yes. But they have completely different lives in the same house. So what does that say for what your expectation of a relationship is, what your expectation of continued growth is? But that's too close to home. You can't poke the bear at grandma and grandpa and mommy and daddy because now you are getting a little too close about what my issues may be.
Yeah, but so then do you want a marriage or do you want roommates?
Exactly.
Wow.
And that's and people don't recognize that.
Maybe turn it off.
I heard that. Don't act like I didn't hear that now.
And that's always the crazy part. You don't people will refuse to equate the strength of the relationships that you have in friendship also needing to be that same level within a relationship. And the same safety and protections that you take for your friends, you have to be able to give that to your partner and expect the same thing.
Absolutely. Absolutely. I agree.
And that includes, oh, well, my friends can tell me anything.
Can they?
Yes.
That's what I was going to say,
Can
because
they?
I know I don't. There are certain things that I have to compartmentalize. There are certain things that I know that I just can't share with certain people, and I won't share. And I won't say can't.
Can I just say as well?
I'm so sorry.
Yeah.
Yay.
Go ahead, Dr. Ann. Dr. Ann, can you hear us? Dr. Ann. You know what I'm gonna do? I think this is my phone. Dr. Ann, can you hear me? If you can hear me, touch your ear.
Can I say, when I work with,
Okay, so we're just behind. I think it's just the light.
You know what? I think I got to fix to it. Hey, Dr. Ann, if you can hear me, go in the private chat and type me your phone number, and I can call you. This way it'll be real time. We'll still stay to keep the video, but I can call you. Oh, go ahead, y'all, and I'll type that to her so she can hear me.
So no, I was just saying. I forgot what I was saying.
You were saying about
You saying you ain't gonna talk.
not talking to
You gonna hold it in.
Oh yeah. So it's not so much as holding it in; it's just being selective. And I think that comes from knowing your audience, right? You know who you can and can't talk to. You know who may be able to handle it. I'm very selective in the sense of I don't want to give information to someone who, first of all, is not going to, if I know that they're not in a place and a space to be able to receive it, first of all. And I think that does come from having a true friendship. There are some friends where, the things that we talk about may be more about finances. Then you have the friends that you can talk about the emotional things, and you can talk about the personal things, or I can talk to about my kids. I'm not going to talk to my friends who don't have kids or never had children about my daughters. My daughters are 22 and 19, so I'm not going to talk to my friend who just had a baby and they're young. So I think knowing who you can talk to, and so tying that into what I did in primary care, when I talked to someone and yes, they were probably comfortable with me, when it was out of my realm and it wasn't my area of expertise, that's when I had to do a referral. So that's what I mean. You have to know who you're dealing with, be able to be there with what your level of knowledge may be, but also know when it's your limit. Know when you can't do it, when you have to say, okay, I care about you enough to punt right now. And so I just, again,
how about
that's
the flip side about oversharing with your friends and causing anxiety from that? I feel like a lot of people from my generation deal with oversharing. So we tend to tweet everything that we feel on Instagram. If someone makes us mad, we'll go on our story, we'll post and say, I hate her. It's one of those things where we use our diary as social media, and oversharing has caused anxiety with us because it's the overstimulation of it.
You call it oversharing, or someone really hasn't taught this generation on really how to process your feeling before you express it to the world? Because sometimes we have to internalize it, write it down, or share it maybe with one other person, because I think what you're stating is something that's very destructive, because if I don't really understand why I feel like I'm really angry or rageful, or frustrated, or maybe even feeling feeling hate or whatever.
I disagree. I feel like
hold on now. Oh shoot. Listen, I like this.
The only reason why I disagree is because the process is oversharing. So it may cause anxiety. It may be weird. It may be like she's not processing her thoughts correctly. The process is by saying, I hate her. I don't understand why I feel this way. I'm mad. I'm this. It's almost you're asking for other people to respond to you so that you can get those feelings out. Because a lot of us, we're dealing with COVID for graduation. We're dealing with not seeing our friends in class anymore. So social media is a way for a lot of people our age to process everything that we can't to family, like she just mentioned. We compartmentalize our relationships and what we tell others around us. So if we find someone on social media and I'm like, I'm mad, and someone agrees with me by liking that tweet, I feel like I'm releasing in some kind of way. So I feel like even though it may seem like I'm not processing my thoughts correctly, I'm processing my thoughts the way I want to.
You probably feel like it's real time.
It's real time,
getting it off
purging your
chest.
ideas. Yeah, everything.
So almost like a sense of therapy.
Exactly.
And and I guess because I'm right on that line of, so I'm 33.
Mm-hmm.
So I'm
You're
right at that
line.
start where social media began, and you know how it was originally used, and seeing the evolution of it. And so what you see a lot more now, and it started a little bit more when Facebook, just kind of blew up and went public, right? Is we call it processing, but it's seeking validation.
Yes.
And there's a difference between I'm using this as a platform to solely vent, to say what's on my mind with no expectation of response or caring what that response was, to now, if I post this and I don't get a response,
it has to, yeah.
Okay, that means there's something wrong with what I said. There's something wrong. Not only that, now there's something wrong with what I feel.
So your question,
and now I have to process
why don't
this
people
negative
go
feeling that I have, and now
well,
there's a lack of validation in this feeling. And so it's like, that's why I said that borderline generation where people who are right around my age, we just kind of sit back and watch. And it seems like it's two extremes. You have the watchers, or you have the folks who are just highly engaged and seeking that validation, and seeking that I need to have this ability for someone to say that the way you feel is okay. But then if you disagree with it, if someone disagrees with it, now it's a war.
I see that as it's kind of a catch-22, because I see my audience, or I see my friends or people online as people who it's not seeking validation. It's more so I'm letting them know that they're not alone. Because I've had a lot of people reach out to me and say, I've never seen someone say exactly how they feel. And so they would open up to me and say, I don't have anyone else to talk to. And I feel like that is something different with what I use my platform for, instead of abusing it. Like you said, there's certain people who use it for just seeking validation, and some people who use it for the attention, and not the attention, who just watch and who are just, the audience.
Dr. Haynes.
Hi, can you hear me better now?
Yeah, I don't know what you did, but you did your damn shout out. Girl, you did your thing just then. I don't know what you did over there, but I got you loud and clear now.
Yeah, I went on my phone, so I'm doing it through my phone instead of my laptop. I thought I'd give it a try this way.
Yeah, we got you now. We got you now,
good.
lovely.
Okay.
Okay.
So yeah, what the question was, why don't people seek help? And there's a variety of reasons that I find, my clients and over the years what I've observed. One of them is social, because the family, friends, they have negative perceptions about what reaching out for help is. Culturally, everyone seems to believe that, you know, they have to be able to be strong, they have to do it themselves. And there's still a massive amount of stigma about seeking mental health because it means that, you know, you are still crazy. So even though I'm a psychologist, and the vast majority of work that I do isn't really acute mental health in terms of things like psychosis or bipolar, schizophrenia, people still have those attachments and ideas with it. So part of it is being able to get people to see that, you know, mental health, good mental health, seeing a health professional or seeing some sort of therapist is actually more of a preventative thing. So I try to get them to think about it as something like going to see your dentist. So we go and get our teeth checked, and we do it on a regular basis because we know that, you know, prevention's better than having to get, you know, massive amounts of work. And it's the same thing with mental health. But what I have noticed, because of the rise in people who now go to see coaches, they are kind of seeking mental health support by proxy, because if someone says I'm a coach, people don't have the same negative connotations in terms of, you know, I'm going to see a psychologist or a therapist. Now, a lot of the time they are actually doing therapy type work. So they are going to see about coaching for relationships or coaching for work that's going to bring up, you know, issues that they may have about family, friends, and workplace, but they don't have the same negative connotations. So I think there's been a definite change in people beginning to realize that talking about their issues, talking about what their needs and wants are, is actually a healthy thing. And I'd also say, in terms of business people, we've talked about they don't reach out. I would actually say that's not the case, because what I found is the more people are able to be successful in their workplace and in their lives, they're much more likely to reach out, because they are, let's be honest, they're smart enough to realize that they need to work in a team. And part of that team also involves having support about their mental health. So I think there's a definite shift, and I've seen it over, you know, the 30 years I've been working in psychology, having the same conversations that I did 30 years ago. Why don't people go to mental health? How do we get people go to mental health? But because of the rising coaches, those there's been a mind shift in people going to speak to professionals, but by stealth, I'd say. So I
So
hope that helps.
so you think it's still more undercover in a lot of cases where people are
Yeah.
seeking out, but they're just kind of, you know, keeping it to themselves and won't say nothing to anybody.
Well, they're reframing it. They're saying that they're going to see a coach. So a coach doesn't sound quite the same as I'm going to see a therapist. Because if someone says I'm going to see a therapist, people go, "Oh, are you crazy?" That's kind of like the bog standard response. Now, going to see a therapist has got nothing to do with going to see a therapist. You know, most people who go to see therapists is because they recognize there's something in their life that they're struggling to change on their own, and they need to get different traction to get some insight into that issue. So that's why the thing I'm saying about business people who recognize that going to see someone is a different set of concerns, because they're used to seeking other professionals to give them advice, whether it be financial, whether it be business coaching. So they're more open to the idea that, okay, maybe I need to go and see somebody about, you know, this particular issue in my relationship, for example.
Oh, okay. All right. Great. You got some chiming in on that? Talk to me, people. They stuffing their face and don't want to talk.
Yeah, I never got any food. I noticed. I'm in Spain.
I feel so bad. I feel so bad.
Wow.
But you know what,
You were
Dr.
supposed to
I did
DoorDash.
not want you eating at this early morning right now. How about that?
You were thinking about my health and well-being.
Definitely.
Very
I got to
much.
think about your health over there now. I can't
That was a
let you.
good save.
I can't let you do that right there. Hey, so what's your thoughts on that? She said a lot of people. She thinking over the course of her time, she's seen a definite shift going on.
Mm-hmm.
You know, I wanted to ask you this, Dr. Ann. Do you think from the, you know, speaking of Anna, from the young people, like, are you seeing more young people now? Do you see more young people, period? Because she did say that they're more expressive.
Yeah, do you know what? It's quite strange, because what I find is that, because I deal with like trauma and relationships, a lot of the young people I'm dealing with are not necessarily as traumatized as their parents were, but they see the effects of the trauma on their parents. So the parents say for example, I'll give you an example. Maybe the parent had a mother that was a drug addict. So now we're on the granddaughter. Now the granddaughter has seen the impact of the drug addiction on her mother, and has seen it filter through. So now at a much younger age, that young girl or young guy, because I have young men as well come to see me, they want to deal with that problem early on. They don't see it as something, okay, I've got to bear the brunt of this for the next 30 years. They're saying, okay, there's an issue here. I see there's an issue and I want to get this sorted now so I can get rid of it and then I can get on with my life. Whereas I think my generation, we tended to kind of stumble through life and just hope for the best.
Okay. All right. Hey, add note. So from a I want to ask Brandy from Brandy.
Yes.
You Brandy's only looking at that.
No.
you kept looking over there. I'm like, what you looking at? Okay.
But not the sound.
Gotcha.
Was that?
Yes.
All right. So from a physical standpoint, because one and I asked you this question, I think yesterday I asked you early this week. I was saying from a physical standpoint, because with you being a PA, you do have to, you know what I'm saying, recommend people because based off of some of the attributes they show from a physical realm, right?
Absolutely. And that can be high blood pressure. It can be headaches, migraines, things like that I'm looking into and asking. And one of the biggest questions that I usually talk to patients about is, how are you sleeping at night? Because I think that is so important because so many of us go to bed with things that are heavy. And it starts out with the small things, okay, for me, it's hard to turn it off. I have a journal and a pen by my bed so I can write those thoughts down and I can, kind of purge, if you will, instead of like Anna going on Twitter, I am, I'm purging that way. But yes, from a physical standpoint, I think we all know that when you're dealing with something mental, a lot of times, another huge one was stomach issues. People would have, issues with their stomach. They can't eat. They're overeating, nauseous when they go into certain situations. So all of those are things that, and I wouldn't say just being in primary care, but as a mother, I have to look at, when it comes to Anna, when I see her dropping weight or she's not eating or she's not sleeping well, or my other daughter, I have to ask those questions, how are you feeling? What is it something else outside of it just being, okay, I want to lose a couple of pounds. If it's not intentional, I have to look at those things. So I think that's important with our loved ones and family members as well.
Well, let me say this real quick, and I'll see you about to say something here. And just kind of pitch this off that, we hear it, Mental Health Awareness Month, right? Yes. I really think we're aware of our mental health all the time. You know what I'm saying? Just individually.
You said we do or we don't?
No, I'm saying I think personally we do. You know what I'm saying? Even though we won't outwardly do it or say something, but like I think we honestly self-assess ourselves every day. I think everybody does it in one way or another. You know what I'm saying? Whether we admit it, you know what I'm saying? I mean, because I have to be honest, I do. I have to. You know what I'm saying? I probably always done it. You know what I'm saying? I have to assess myself and be like, right. I may not say nothing.
That's true.
But I'm aware of it.
That's that negative or positive. Like when I get up in the morning, is it, man, I didn't sleep well, so today's just not going to be a good day. Right. Or so you're correct with that. Sometimes we are internalizing and already projecting how we feel without knowing that, like you said, it is a self-assessment at the end of the day. So that's a good point.
But even like you were saying, I would challenge that to say, are we aware of our mental capacity versus our mental health? Because health means that we're actually taking into consideration what that full balance looks like, just not whether or not good day, bad day, end of conversation. But I think we're very aware of our mental capacities without the ability to transform that into how to make it healthy.
Great. Wow. Yeah. I had a wow on that one. You wild Kenzie on that one right there.
I was like, wow. Yeah. Because I think that's very true. And I don't think I've ever looked at it from that aspect before. Like, what is the actual capacity? How much can you handle? On the scale of empty tank to full, how full is your tank? So that's a good point.
Wow.
Hugo, what were you about to say?
Well, when Brandy was talking, it kind of reminded me, in the old days, the country doctor could actually look at you and tell you what your problems were. They could see the color of your skin, or they can see some type of inflections. Nowadays everything is a test.
Right.
But it also reminded me of something, and I know it's like, how many times have I heard as I just don't do the drugs in front of my kids. You don't know. I go, okay. Or just like the people who are like saying like, yeah, I fight with my spouse, but the kids don't really know. I'm thinking kids will pick up and know if there's an addiction or there's tension. They may not be able to put their finger on it, but it almost comes to that thing is there's so many things that are almost that energy source that you feel it. Or you can kind of look at it. I always look, some people will say, look at photos and go, I was here. I don't even have to know. I could see by the puffiness of their face is how drunk they were on that night.
Wow.
You can look at certain things. People go, oh, I hide it well. You can't hide dilation of pupils. You cannot hide certain effects that things have. But I mean, it kind of brought me when you were talking about that.
Absolutely.
But you can't hide it. Truly, I think, and it almost comes at it's like you exude. I always say when I was an addict, I could attract more addicts. In recovery, I attract more positive energy.
Wow.
And those who are in recovery, who are still in active use, will still find a way to, as much as they try. But I seem to attract people who know that I'm trying and need me not to try anymore. Okay, so do you think that I think I just need to stop going to these meetings. No,
that's not the answer.
that's not the answer. That's not the answer. We're going the wrong direction here. And it's that capacity. I can only be surrounded by bad people. No, we're only surrounded by the energy that we're putting out. And it is something that you are telling people subconsciously that I'm not quite where they are, but I need to look like it.
Yeah, and people would say, how did you find bookies? Ask enough people, you can find a bookie.
You can find one.
Just like saying this is, you ask a drug addict, they know who a drug dealer is. They know where to get drugs.
And just like that, I need to move. I just don't need to be in this area anymore because I know too many people. And if I move somewhere where I don't know anyone, then I can't have access to drugs.
Right.
You seem to find a Walmart everywhere you go, don't you?
Same thing.
We can find whatever we want to find.
Right. Hey, let me Terry Jones has a question. Dr. Ann, can you see that question on the board on the screen?
No, can you read it out to me? Thanks.
Okay, I'm sorry. All right. It says this is Terry Jones. He said, I found one of the biggest problems in getting mental health support is the professionals using medicine too much and not teaching how to deal with emotional expression. What's your thoughts on that?
Okay, so a lot of people have an issue with medication, and I personally don't have an issue. Now, as a psychologist, that's quite unusual because we're dealing with the psychological and the emotional. Now, the reason I don't have an issue with medication is for particular reason. It allows the system to calm down enough to get a window of opportunity for the psychological work to be done. However, I also recognize that a lot of people don't like to take medication, and they want to use other means to be able to do some health work. So what I would suggest is if you find a medical practitioner who is stressing that you need to take medication and you're uncomfortable with it, what to do is to try and find another provider who is more in your space, because one of the things is that not every therapist, not every provider is going to fit you. So you need to find somebody that you feel comfortable with, that you can build a relationship of trust with. Now, if that medical provider is saying do medication, but isn't providing any follow-up support, then that's kind of like a sloppy provider. You're looking for somebody who's going to look at you as a holistic whole, look at what your wants and needs are, and try to meet what you're saying that you think is going to be best for your mental health. So yeah, there's certainly some providers that will only say, take a pill and that'll do. And if that's what they're suggesting to you, then that's not really sufficient. So it would be a case of saying, okay, I'm going to find someone that's going to be able to provide me at least both. And if you really have an issue with medication, then to find a provider that's just going to provide you with the psychological skills training that you think that you need.
Okay.
That answers it.
And I think this add-on piece to what he was saying also, and I think this happens to a lot of people, especially that look like me, right? He says, I felt that they were using the script and not listening to what I had to say. The best professionals he felt are the ones that are good listeners.
I agree.
Yeah, I
But
mean, I think we all have I think we all have that experience where we can go to a therapist, and a lot of the time they've been trained in a particular model or a particular theory, or they've got their own particular agenda that they want to put forward. So if you have that sensation that there isn't a gel, if there isn't some way that you feel that this provider is actually trying to get to your skin and understand what your perspective is, I would just say go and find a different person. This is not, you have to go one person and that's the person for you. If you don't gel with that person, you have every right to go and try someone else until you find the provider that you work with best. Because this is really important. If you go to a dentist and the dentist is rubbish, you're not going to stay going to that dentist. You'll find another dentist. And it's exactly the same with a therapist. We are not God, and we do not suit every client. So, it's for the therapist to be big enough to recognize that it's not a personal rejection. It's that maybe we're not the best person suited for that individual.
Okay. And I have a question now. I know he had a question. This is going to stir the pot up right here. Because I'm a pot stirrer. I'm going to push this button because I'll be stirring the pot.
Do I need to try to say it?
No. What from a patient standpoint, okay? I'm the only patient. Everybody else seeing here is the professional, okay? I'm okay. She's a patient too.
2 patients. There we go.
So my thing is this right here. How do we the dynamic that I've seen sometimes, and this doesn't apply to you or whatever, there's the therapist counselor confusion with patients sometimes. Because some patients say, well, my counselor is saying this, but my therapist is saying this. And there's a dynamic in that also. And I think people don't talk about that. What's your thoughts?
I think I need a potential reframe.
Monique challenges everything. It's just Monique
No. I want to make sure that I answer
see him
properly.
saying it more as like,
what's the difference?
So for me, I've gone to a counselor, and then I also go to the therapist, and then the counselor would they listen more. They'll actually hear exactly what I'm going through. But then my therapist, they see me as more of like a robot, a number. And so they stereotype basically all of the things that I told my counselor, but they'll water it down. And it seems as if everything that I told him went out the window, and it's more of like a script, just like how Terry said. It's exactly that disconnect where you feel like it's playing telephone. You're telling my mom something and she's telling you something. It's kind of the same, but it's not exactly what I'm looking for.
And she said exactly what I was saying.
Okay.
Before Monique was trying to chop it up.
No,
Monique.
no,
Monique, you always want to chop something up, Monique. Shout out to Monique, always ready to chop something up. That's why I got on the panel.
Yellow button.
That's why I got on here.
See, that's a good welcome to Houston. Chopped and screwed. See? Well, I okay. Now, thank you for clarification. I hear what you're saying.
It was clear. Anna understood everything I said.
See, but here
you just had the wall up. The wall came up. Soon as I started talking, the wall came up.
And I think that's the best part about the people that you have on this panel, because the the style of training is all so different. The modalities that each of us work from is completely different. I am the clinician and the counselor who didn't want to be a counselor. So my perspective and the way that I operate with my clients may be completely different than that. And I know for a fact, it is completely different from that of Dr. Ann and from that of Hugo. Like, it's the way I interact is just different. But I hate to say it, sometimes it really does just basically come down to that training. And people forget that they're, therapists, counselors, all of those are individuals. And you're still bringing your own personal experience. You're still bringing your lens into this when you're helping people to work through the things that they're going through. And sometimes burnout happens, right? And we just get into this, well, this is what works with everybody. And this is just, we're going to get on. That's where that script part comes in. But a lot of it does come down to training. A lot of it does come down to what is your own personal, frame of thought and how do you interact with people.
I think the comment up there.
And we have to be honest. Some therapists just aren't very good. Mm-hmm. That's the important truth. So if you're going to see somebody and they're treating you like a number in a script, then that's on them. That's not on you. Mm-hmm. So you may have a counselor. I've seen counselors and they work from a script. So there's not just about the training, but some individuals just don't either have the experience or the interpersonal skills or the listening skills or whatever the necessary, magic is to make you as a patient or a client feel that you're being seen as a 3D person. And if you have that experience, you are quite within your rights to go somewhere else. And I would strongly suggest you do.
Yeah, Dr. Ann spoke on that.
Yes, she did. And I do see where Mr. Terry is saying that he prefers to use medicine when proper medical tests are done. You said you disagree, Anna?
I definitely disagree with that because I feel like you only know if the medicine works for you if you try it. So it may sound like, oh, you're just trying drugs, but some people actually need the medicine when they don't realize that they do.
But on the other hand, I do see what he's saying. Let's rule out that it may not be something physical that's causing the emotional, that could be causing what's going on emotionally. The same way that I spoke earlier about, you have someone who may not be sleeping well, they have anxiety, they have this. Well, if they have sleep apnea, for the most part, that could be the reason that they're not sleeping well, which is also why they're having bad moods, why they're feeling depressed, why they're having anxiety. So there's some validity to what he's saying as far as that goes, because, there are some things that as providers, we need to take a step back. And when a patient comes in and says, I have anxiety or I have depression, or even if they don't use those terms, but we know as providers that that's what they're exhibiting or that's what they're explaining, to make sure that we're taking a step back and not going straight to medicine, but we are making sure that, let me make sure you don't just need a CPAP, you know what I mean? Or let's just make sure, there's not something else that's going on, that you're pre-diabetic, that you're overweight, you're not active enough, and we need to get you moving and getting you some, or, even we talked about it the other day, low vitamin D, things like that, because you're not getting proper sunlight and getting out. So I do think as providers, we do have to step back sometimes. And I'm saying this because I would normally be that first line before they probably come to you or come to you, or even come to you as a life coach to say, I need this assistance. For me, if they're coming because they're starting to have these physical ailments now, and it does manifest as anxiety or depression, I totally agree with Terry was saying. Okay, let's do some testing. And then I know that gets on a whole nother realm because I'm coming from a military standpoint where we could do all the tests we kind of wanted to, right? Civilian sector, I know it's completely different and it's
Yeah.
very limited. So we also have to look at that. And that may sometimes be a reason why you don't have providers who are ordering a battery of tests for you. That may be a reason why, you know, or pharmaceutical companies are also a huge factor as far as this goes. And so they could be driving why, you know, I'm giving out X medication because, you know, for whatever reason, this is what the organization that I'm working for is pushing for this particular company at the time. So, you know, there's a fine line. There is a fine line, but I think as providers, bottom line is not only do no harm, but make sure that you're just doing the right thing.
Kenzie, what's your thought? You've been over quiet a little bit quiet over here now.
Maybe bring this little rascal.
It's all
over
good.
here.
We got him. I told you. I got him. Go ahead. No, I need you in. I got him. I play with him.
Don't treat my friend like that.
But I think that in certain aspects, medication is absolutely necessary. And I don't think that you have a good understanding of what it does for you, whether it works or works against you until you give it a try. Even if you're starting with the lowest dosage possible, and then working your way up, or then you're like, I don't like the way this makes me feel at all. Can you please just discontinue this? I actually have a question for Hugo about that. If there is someone who is experiencing addiction, alcoholism, or what have you, and they are on a journey to be sober, and they've had a history of abusing prescription meds, would they be someone that would be a candidate to have meds in order to address something like depression or anxiety, having an addictive history?
Well, that's a challenge. Well, I'll first answer it with my own personal experience. So when I walked in, I'd already been in therapy before I actually went into a 12-step room to deal with compulsive gambling. So I already knew that I was already crazy. Like I tell this story, as a definition of crazy is I paid someone for 1.5 years, a therapist, just so I could lie to them, so I could stay in my addiction. That's how crazy it is. I don't want anyone to touch it. But after a while, my therapist said, okay, we're doing a lot. I believe a lot in talk therapy. But he also said, I also want to start you off on some antidepressants. Here's the thing that I had learned from someone else before I walked into therapy is that each of us is responsible for our own mental health and our own lives, even to whoever you go to. So I'd always heard this as kind of sort of like Monique was saying, it depends on our training. Like my dad said, if you go to a surgeon for your issue, they're going to assume I just got a cut. They don't look at something else, possible option. So when I went in, I knew I always had an issue swallowing pills. That was my own mental block as a child, because when I was growing up, my mother would say, okay, you got to take this medicine, but don't choke on it. So I always got a mental block because I didn't want to take any pills, but I wasn't a big fan of using pills. So I always challenged my therapist. I guess I don't want to be on antidepressants. I need to feel, I don't care how suicidal I am or depressed I am or crazy I look, I wanted to feel everything. And I wanted to kind of work it through the 12 steps of recovery and through talk therapy. But you actually bring up, there's a lot of people so my own personal experience is I fought for what I need. And people have to kind of fight, but they also have to be open to suggestions. Like you're saying is maybe the medicine actually would help you get to the point faster. So you have to almost know your body, know who you are, as well as be open to what the medical professionals are stating. But on this, that is a challenge, though, because I've known people who go into therapy. They'll be in sobriety for maybe 5 years, and they'll go into some other type of, let's say, back surgery, and they'll be saying, like, I can't take any of these pain meds. And I think sometimes you can get so focused on what the 12 steps of recovery say, and then saying, I'm not going to take any meds, to me is you just have to be monitored closer. You have to be open with your meds. And it is a challenge. And I think there's not, just like anything, it's not a yes or no. It's an individual. But if they do, and they already have that history of going down a road of being very addictive, to understand, okay, is there a different type of med that might be less addictive? And you got to look at all the options and challenge it. And I said, is you got to just keep challenging it to what is, and ultimately look at the long end. I got to get through this surgery, or I got to get through this depressive state. I got to do something. And that's that goes. I can go into another question. Is people are so afraid.
But she had a question, and I'm not trying to apologize. It's just one. I got Dr. Anna over there, so I want to kind of keep it so everybody's kind of, putting it in there, because I do appreciate her standing up so late.
The abusing but using other substances. So a lot of people my age have resorted to smoking weed as a result of like solving all of our problems. I've noticed that there is an addiction with the feeling of weed, and I've noticed it with the way that they're so sluggish. They can't even sort out their thoughts, to the point where they're using it as if they need the medicine, because they're back to back to back smoking, or the vape back to back to back vaping, or the hookah back to back to back. It's an addiction because we need some kind of vice to calm us down, but we don't know what it is. We're like, oh, medicine is so bad. So we resort to other vices, as in weed or vape, nicotine, stuff like that. So I that's why I talked to my mother, and I was like, hey, there's a problem. I think I have a lot of anxiety. And she was like, how do you know? I was like, I'm abusing vices. Like, I don't know why. And she was like, well, you need to talk to someone. And I said, okay. I was like, who do I talk to? Because I'm perfectly fine. I was like, I'm perfect. Like, so I went to go talk to them, and they're like, you have OCD and you overthink. You do a lot of things to where that's why you abuse substances. And so I talked to people who are just like me in therapy, and I realized they were doing the same exact things, overdoing weed, overdoing nicotine, overdoing all of those other vices that they thought was a better alternative, but they just really needed medicine. And so I feel like you said, it's monitoring yourself, and all of us knew, hey, I'm doing way too much with whatever I'm using. And even though it's deemed as weed is non-addictive, the sensation became addictive. The feeling of that relaxation was like, oh my God, why do I feel so good? And that's what I'm starting to notice with this, is like the CBD shops that I see every corner. I'm like, crap, it's just as addictive as any other drug.
So Dr. Ann, what's your thoughts on that?
Okay, so the thing about marijuana is, the discourse is it's not addictive because it doesn't have, sort of the half-life of, say, an opioid. So we don't get the hit, and then we have the craving quickly. But for me, it really is, it is addictive, because what happens is someone who's using it and they're a heavy user, they begin to, mobilize their life around that set of behaviors. So they're thinking about how they buy it. They go through the rituals of how they're going to take it, whether it's by rolling a joint, how they go through that process, and the whole thing becomes a central part of the life. Now, I think Hugo would tell you that when he was gambling, everything he does is through the filter of how can he get to make a bet. So how much money has he got? Everything becomes perceptually filtered through the thing that's become the main focus, the main issue. So marijuana is is the same. The problem is that we see it as something that isn't as serious, but just like anything that we overuse, it will come with problems. And one of the main issues with marijuana is paranoia. It's got a long history of causing, increased paranoia for long-term users. So they won't necessarily experience it as paranoia, but it becomes really heightened anxiety. So being able to talk in public, being able to leave the house, all of those sorts of things become, increasingly difficult. Now, what, we're saying about the anxiety is that a lot of my clients do have a baseline of anxiety, and they're all using some other form to be able to avoid those sensations, those really uncomfortable physiological and psychological sensations. So that's where the addictions come in, and they become a really good way of avoiding those feelings that are within the body and within the mind. And as the person gets more and more used to using those behaviors, or substances, then they get further and further away from actually dealing with the source is. And that's, that underlying anxiety. So a lot of the work I do initially with anybody is being able to help them understand what anxiety is, what's happening in their body, so that we can do some work to being able to integrate, what's happening in the mind, the thoughts that they're having, and how exactly that's related to what's physiologically happening. So it's an incredibly complicated topic because it's multifaceted. But when I'm working with clients, a lot of the time I'm starting from a very similar standpoint, and that is, how does anxiety work? Why are we doing these behaviors? What is the secondary gain? So one of the reasons that, Hugo was saying he was in a year of therapy, he's going through the motions of talking, but really, he knows he's playing a game. He knows that he's been able to tick the boxes to other people to say he's in therapy, but really he's got no intention of making the change at that point. But the secondary gain that he gets from the gambling, it far outweighs what the change element would be of changing that behavior. So one of the reasons people don't see mental health providers, they don't deal with their mental health, is because they do get something from having that mental health issue. There's something that serves as a purpose, and that often is about avoiding dealing with an underlying anxiety or dealing with something that, for them, if they face it, seems far too painful.
So Monique, I'm gonna go to you because you're addiction specialist, right?
Mm-hmm.
Okay, so now, where does it go from them coming to you as being addicted to whatever it is, right?
Mm-hmm.
So, is medicine involved in that, in what you do? Like, do you write scripts? Do you, and I'm kind of penning it based off of what Terry is saying,
right,
also, because he said that, he feels that the panel is missing this point. He said medicine is good, but it must be used with proper medical tests. I knew by having several nurses in my family that chemical and blood tests must be performed before giving medicine.
Right. So, with my history with addictions, things like that, medication, I have worked with people who are on methadone, which is a substance that is used for those who are in severe opiate addiction. And it is a drug that helps someone to eventually taper off of that safely and not have to experience severe withdrawals. The other counter to that is Suboxone, which doesn't have as much of the opiate in it. It also has naloxone in it, which will, if you are actually trying to take another opiate, it's going to kick it out your system, which sends you into what I like to call liquid withdrawal. And it is not fun. It is not a great experience. So when it comes to where I'm meeting people, there's most of my experience, I'm meeting you because you're saying, I need to be on something to get me off of this. And which one is better for me? Is it better that because methadone, yes, it is the gold standard in opiate addiction, opiate addicted medication assisted treatment. It is the gold standard. However, when you look at the rankings of things, methadone is the Mac Daddy of them all. And people have found that methadone can be just as hard to come off of as any other opiate because of the way that it binds to your receptors, the way it interacts with your body. Your mind and your body does not know the difference, for the most part, between heroin and methadone, but they know methadone works. And it is supposed to be a slow process. And people will come in for that type of treatment and say, oh, I only want to do this for, a couple months, get myself straight, and then I want to go back. No. Methadone is a minimum of a 1-year treatment standard in order for it to be effective. And that is 1 year of being on a stable dose, not including the time it takes to get there, not including the time it takes to taper you off of it to get back. So we're kind of really looking at like a 2-year standard. But with what Kenzie was saying, I have a lot of people who make that comment of, I want to be sober. And it's what is your definition of sober? Is your definition of sober, I am no longer using illicit substances in order to control my behavior and to be able to make it through the day? Well, I don't want to be on anything. Well, so what are the steps to not be on that? But just like you were saying, there are plenty of medications, and Hugo mentioned it before. There are so many medications that can be abused. And there are also mental health medications that you can be put on that, you know what, I'm sorry, because of your history, we can't put you on this. So here's the alternative. So one of those is, instead of folks taking Xanax and Klonopins, things like that, which, let's just throw that out there. Benzos are about to be the new epidemic. So
Yes.
that's one thing on its own.
Hold on. We got a young person thought. Go ahead and say it, Anna, please.
He had to be kicked out because he was abusing his own medication, which I've
Mhm.
never heard of before. He was talking, and I don't want to, say too much about him, but basically
Right.
he was feeding off of his own medication and saying, I really need my Klonopin. I really need my Klonopin. I need my medicine. And the doctor knew exactly what I didn't understand, because I was new. I was like, what? Why is he
Mhm.
like tripping over his medicine? It's not, I don't like my medicine like that. Why? So they kicked him out and said, you have to go back to inpatient. Like, you got to be an inpatient person, because he was abusing his own medication.
Mhm.
So
What?
yeah, so if you abuse your own medication, they can tell that you're way too tired or drowsy, or you're like sluggish on purpose. Like it's just routine. You're really trying to be in that really relaxed state. They'll put you in inpatient therapy and make you fiend off of that will make you get off that medication to where they'll put you on something else so that you can learn kind of detox your body from that
Mhm.
medication.
Dr. Ann, have you ever had to send soldiers? I'm not soldiers. Send patients to. I was looking over there at her. That's what I was thinking. You don't think about the soldier over there or airman. Have you ever had to send patients to end therapy because they were so dependent on the medication?
My client group on the whole, on the acute end, so I wouldn't be at the level of inpatient, so I wouldn't be dealing with somebody who say is psychotic or bipolar for those sorts of issues or addiction issues. Generally what I have is clients who, whilst I'm in therapy, will admit after a while that they're abusing drugs or alcohol. So I would tend to see more people, for example, that abuse marijuana or cocaine. That's quite regular, and that takes a bit of time for them actually get to the point where they're admitting to me that they'll initially come to see me about something like, I'm unhappy at work, or I'm not getting on with my partner, and over a period of time the other negative behaviors start to come up. So often my clients aren't on a level of medication. They're not really seeing any other primary caregivers or primary providers, so they often don't even see their GP. So when they come to me, I'm usually about the first person they really start to admit how chaotic and how many negative behaviors that they're actually undertaking. And it's quite it's quite scary to the extent that they're using these behaviors in order to keep themselves together enough to function. But in some ways, of course, it's having a completely the opposite effect. Can I ask Hugo, you came from like addictions in gambling. How did you kind of manage to keep going and keep the secrecy going? How did that work for you? Because I'm just intrigued.
In terms of the secrecy of gambling?
Yeah. I mean, because it's one of the things is, with people with addictions is, they're very, very uh, adept at being able to lead double lives. So how did that kind of work for you? How did that play out?
Right. Well, that's the thing. Actually, with compulsive gamblers, actually isolation and the loneliness is actually at a different level than alcoholics, being both a drinker and a gambler, I've noticed that, and talking to other compulsive gamblers, is that the ability to kind of manage, because you got to get the money or the credit cards or the loans or all the different manners so you can stay in action, is that, yeah, you just feel more isolated. And, you know, eventually, like they say, you finally get tired of being tired. And for me, it was, I didn't know I had to do this process. I had to first go into to deal with not drink. Then I had to, a year and a half of that. Then I had to get into therapy for a year and a half. And then after it took me about 3 years to finally be ready to do everything full throttle, to go to 2 12-step meetings and a therapist and to attack it. But it takes, it takes work. I say the hardest work, people say, oh, it takes a lot to go to the gym and, to get this perfect body. It is actually much more costly on your body to do all the hard emotional work, to actually get into the core of who you truly are as a person and to get that out on paper to another person. And kind of like what's something that Anna was talking about. And really you have to, that's why it's important to always either have a therapist, have a sponsor, have other people to almost keep you accountable in the beginning. Because what she was saying, you can use almost anything as a crutch. You may be taking medicine to say, oh, and then you overtake the medicine. Or you can you get to the point, well, my therapist says this. Well, at some point, you have to take responsibility for your own life. The therapist can help guide you, ask the right questions, can really probe you, get underneath some of those emotional issues. The same thing even with 12-step group. My sponsor says I need to do this. Okay. Yeah, the first 90 days, maybe as you're going through the 12 steps in the beginning, it's advisable to listen more than to use your own brain, because your old way of doing things wasn't working. So maybe you have to try something else. But at some point, it's just that constant growth, and you just never know. And this is one of the things we could almost talk about, is how the brain functions and the desire. It really comes down to the desire, and get off the whole the crutch thing, because at some point you got to let go and jump off the cliff or jump into the ocean and start living. And that's why I keep talking about got to live about the miracle of recovery. And it gets scary, but it's okay, because even this past year, there's not one person in this world did not feel that their anxiety did not go up, that their depression went up. Everyone, if you did not feel any anxiety or depression, I'd have to check your pulse.
Yeah, definitely.
Really. I do have a question for both of you. So, and maybe it's because of the type of drugs that your patients were previously on, where it required a counter medication. But do you not think that there's a way for these patients to, so let me back up. I think that sometimes people do compare addictions, whether it be gambling or, something like that, to also being addiction to an actual chemical product. Is there not a way do you have patients who are completely, I want to, get out of, I don't want to be on any medication. Is there a way for them to do that? And is there something that as medical providers we can do so that's not the first line? And I don't know if you even want to share or even know of people or have a friend who's been in recovery and it took medication to help.
I know plenty of people that, like I said, every journey, your own journey of recovery is your own. Correct. There is not one method that works.
I understand.
Some people get back into their church. Some people have, when they're in the middle of their addiction, they have totally said, God does not work. God doesn't love me. And then they get back into it if that feels right to them. Other people go, really deal with therapy. Some people just deal with the 12 steps.
Okay.
Some people will the 12 steps with medicine. Some people, there is no one way. That's why I said you have to take control of your own life. Ultimately, the 12 steps of recovery about each person taking responsibility for their own life. You got to take responsibility for all the stuff you did, And you got to acknowledge the good stuff you did, and you got to acknowledge all the crap and all the hurt that you have imposed, that you have caused a lot of wreckage in other people's lives. You are ready to now take responsibility. That's why we eventually, after a while, you go through the amends. You go to your parents, your siblings, your kids, your coworkers, your bosses, and say, you know what? This is what I did.
Right.
And you say, and you never, and here's the thing, you never know how they're going to respond. And it gets scary.
Yes.
But yeah, those are the things. There is not one. I mean, you got to, that's why I said you got to take responsibility, but you got to be open to suggestions. Kind of like what Kenzie was talking about. You got to try it.
Yeah. Yeah.
And if maybe one drug doesn't work, but another drug may,
Yeah.
or no drugs may work.
Right. And that's the
talk
reason I was
therapy. Like for me,
asking.
it took me a while. You got to almost like trust the process. There's certain things, but.
And that's sort of the big crux behind any type of medication assisted treatment. It cannot be medication only. You have to actually participate in the therapeutic process that goes along with that. Because at that point, now you're only operating out of fear and you are now doing transference.
Yeah.
That doesn't work. That will never work. That's how you end up in situations where, well, I don't want to come off of this because I'm scared of what I'll do. I know who I am on this medication.
Right.
So if you don't actually take the therapeutic process of your, treatment seriously, you'll never come off of it.
Yeah.
Or you switch addictions.
Exactly. And so now my
that's
new,
a good point.
That's what I was about to say.
all I do is I take my methadone at 5:37 every single morning. I roll over. There is not a day that I miss. There is not this. I have been on this for the past 20 years. And I have clients who have been on methadone 20, 30 years. And it's not that you're not stable. You're doing great. But you give all of the credit to the methadone instead of your hard work and diligence in ensuring that you progressed yourself past that point.
Absolutely.
So there are plenty of people who you don't get to see often the success rates. You don't get to see high success rates in medication assisted treatment for that fear factor, one. And a lot of times because of the accessibility. So if it's someone who, well, yeah, I'm on private insurance and I'm on Suboxone, fine. Typically methadone is pay out of pocket or Medicaid. That's it.
Wow.
So your ability to be able to do that and to be in those situations, how long can you maintain doing that without proper assistance and insurance? And just like what Terry is saying, a lot of times it has nothing to do with them not wanting to do the test. It is your insurance or the county isn't going to pay for you to have tests done just for you to get on this medication.
Or to not be on it. Or to not be on it.
But what about the new craze with chasing the positivity of it? So I know I was just talking to a lot of people. We were just talking about mental health in general, but there's this new positivity type of chain that we're falling into where we're doing too much with working out to where we're causing body dysmorphia, or we are trying to reach out to a whole bunch of people by doing day trading, right? But we think
could you explain that body
dysmorphia.
Yeah, explain that.
Body dysmorphia basically means that you see yourself differently than what others see you. So you're losing a whole bunch of weight. You see yourself as a big person the whole time. You never see yourself as that actual look. And I fell in that too when I was it was just a lot going on in my life. I was working out a lot, but that was my way of getting rid of my anxiety, but I was going overboard. I didn't realize I needed medication. I was just working out. I was like, I don't know why I don't feel better. I keep on working out. I don't look better because I didn't feel better. My mind wasn't good. So if my mind wasn't good, I kept on chasing something that I couldn't really find. And so that body dysmorphia just came from my bad thoughts in my head that I didn't know where it stemmed from. So my mom would see that. She'd be like, oh no, she was like, you're reaching your goals. And I'm like, no, I'm not. I don't see my goals, So that was another sign that I realized I needed to seek more help than what I was doing myself in the gym or I was like, oh, I'm reading all these self-help books. The Secret told me if I manifest this, I'll get this. I was not mentally okay to manifest anything because I didn't know what I was manifesting.
Right.
So I feel like this day and age, we go to social media and we find these fake self-help gurus who tell us you don't need medication. These doctors are just gonna treat you like a book. And we hear that and we're like, oh crap. So what do we do? Do we work out more? Do we tweet more? Like, what do we do? Do we manifest more and write in our journal all day, but we're scribbling thoughts so we can't really, sort out? I feel like a lot of us, especially my age, need to see that, no, we need to actually sort out, like my mom told me, sort out your thoughts, but keep social media, but keep it in moderation. Because I was going crazy. I was definitely putting all my thoughts out there. And I was like, I don't know why I'm freaking out. But my mom, she started noticing that. She was like, why is she tweeting so much? Like, why is she seeking some kind of attention that I can't give her? And it was because I didn't know that I wasn't mentally stable. I didn't know what was going on. I was just having seasonal depression. I didn't know why.
Yeah,
Yes.
and that's true.
I'd love to hear, especially with Dr. Ann's clientele.
Yeah.
I would love to hear your perspective on this because I have a very interesting one, but that's due to my realm of experience, right? But Dr. Ann, I would love to hear your response to this just because of the breadth of your clientele.
Yeah, I mean, the thing with the social media is, going back to what Hugo said about addictions move. So, we kind of like deal with one issue and then it pops up somewhere else. And social media in particular is almost like going to Las Vegas and putting the money in the slot machine and you get somebody to like your comment and it's a ding, 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 ding sensation. So people can get just as addicted to that process because it's not just, maybe they start out and it's not something that's really significant. They just put a picture out, but then when they hit the jackpot and they get, somebody's following them or they're watching that or someone's validating their thoughts, it becomes the same biochemical neurological processes as it would be for any kind of big win hit. So that's the danger of social media. The second danger with it is basically you're not living in a real world. You're having conversations which really aren't contextually based. They're not real. They're happening in this virtual world. Well, let's be honest, how we portray ourselves in a virtual world isn't necessarily who we are. So we're all constructing different identities, and that means you're constructing an identity to put out into the social world, and then you're engaging with other people who are also engaging with these constructed identities. So the problem is that's where the falsehood comes in. So then you're not having those real meaningful conversations and you're not having those real meaningful ways of developing and learning basic social interaction. So for young people in particular, when anxiety is really high, that's one of the problems, is that they're not having those real validations. And young people are particularly self-conscious, so it's easier to hide behind a mask of, here I present myself in this way. So social media's got a whole massive range of issues to do with it. Now, when you're talking about those conversations where you're having to go to therapy, etc., one of the things that the main way that I work is I use hypnotherapy. So I do a lot of regression work, and that's basically to enable my clients to be able to tap into their subconscious. Because what generally happens is, I worked in psychology, traditional psychology, for probably about 25 years, and I'd see my clients week in, week out, and they'd come and they'd tell me, well, I've noticed it's when I don't sleep enough, or they notice when I eat these types of food, or I notice when I exercise. And then they'd go away and then they'd come back the next week and we'd have the same conversation again, and nothing really changed. So about 5 years ago, I started using hypnotherapy in my practice, which meant my client group got much more complicated, because then I was able to deal with people who were more traumatized, because before that I didn't want to work with them because I couldn't keep them safe. And I felt a bit of a wire. I was like, I'm going to rip off the scab, tell me all your dirty laundry, but I don't know what to do with you. So when I started using the hypnotherapeutic work, what I really quickly discovered is how we frame what's going on in our conscious mind is not really what's going on behind it. So there's this level beneath everything that we say and we present that isn't necessarily what the programs that we're running that create these behavioral, physiological, psychological reactions. So someone feels anxious. I mean, I can give you an example. I had a client who came to see me about her work, her job, and she was very, upset about her job, and she wasn't, she was in a bad mental state. So we did some regression work, and basically regression is when we go back into memories. So the first memory she came up with was she was a little girl and she was eating chocolate, and she was sitting behind a couch eating chocolate. And I'm thinking, well, what's this got to do with her having, problems in her job? So she's there and her mum's there and her mum's boyfriend's there. And I'm starting to think, oh God, there's something bad happened. Has she had some sort of trauma? But basically what progressed was that her mum had a boyfriend at this point in time, and this man, the relationship had split up, and she hadn't had an opportunity to say goodbye to this guy. And this was a memory from when she was 5 years old. I'm thinking, what has this got to do with work? I've got no clue. I'm just going, okay, I'm along for the ride. Your memories, I don't know what's happening here. So anyway, we went around, we bounced about, and she was playing football with her cousin, and she was doing this. And I'm still thinking, what's this got to do with work? I've got no idea. So she went away. We did finish the session, and she went away, and she seemed very happy with herself. Well, the next week she came back, and she had quit her job. And I'm like, oh my God, as a therapist, I'm thinking, I never said that. I never told you to quit your job. I never made any suggestion like that. But that's what she did. Now, I spoke to her about 3 or 4 years later, and I said to her, because I was in contact with her, and I said, that time we had that session, and we had that session, and you went away and quit your job, I just about died. I was like, oh my God, I don't want to be responsible for you quitting your job. And she said, no, well, the thing was, it was exactly the right thing for me to do, because that job was making me extremely unhappy. The man I was working for was incredibly unethical in his business practices, and I felt like I was colluding. So it was exactly what I wanted to do. Now, I still to this day have absolutely no idea what the connection between her being behind a couch eating chocolate and her giving up that job is. But whatever it was, that the emotional issue that was involved in those sets of memories was something she needed to resolve in order to do certain behaviors.
Man.
And I see that all the time with my clients.
So
their stories don't necessarily make sense to me, but at some level, their interpretation, it makes sense to them.
To the patient. I guess that's what matters, right?
Yeah. Yeah.
Okay. So Monique, you said before you deferred it off to Dr. Ann. So what was that situation?
And I think Hugo was about to speak on it as well. This whole realm of you do not have the ability to not be okay in today's society. You do not have the ability to have a lack of perfectionism in our society without it being seen as, well, you're not adding to the world. You're not, being productive. You're 22. You don't know what you want to do with your life. You don't have 7 businesses and you're not a millionaire yet. What is wrong with you? And it's, well, I'm sorry. Like, wait a minute. Hold on now. We just started figuring out how to properly chew gum and walk and make sure our shoes weren't tied at like 28. So what do you mean I don't have this? And so it's easy to say everything is amazing and everything, you go out and you be the best person you are, ignore those negative things. when you've only experienced maybe about 2 years of struggle? Is that fair that that's the person? But think about it, like, is that fair that that's the person that you're taking your life advice and now you're operating for the next 10 years based on you're not good enough if you weren't perfect at 22?
Yeah, I know a lot of people my age who are even writing books. Are you under 25 and are you under 25 and actually doing what you should be doing? Do you have a kids yet? Do you have like a family? Yeah. It's I don't know, it's stressful because we see a lot of stimulation, and I think that's what it's it's what's messing us up is the overstimulation. We see things 10 times more than what my mom sees. So I tell her, I'm like, oh my gosh, I'm so overwhelmed. She's like, from what? I'm like, because I hear a whole bunch of different
Consumption.
It's a lot. And I also read this article and it said people who are Generation Z, X, I don't even know what it's called, XYZ or something like that, because I'm Generation Z. I'm Generation Z. I'm not even a millennial. They said that we see 10 times more stimulation than the millennials, to the point where the death rate, the suicidal rate is 50% or 70% more than any other generations before us. So when I heard that, I was like, is how? But I see TikTok and I see Snapchat, I see Twitter, all these platforms that we have that I grew up with. I didn't just see it happen. I grew up with all of them. In 2002, I was only 4 years old, and that's when the first laptop I saw my mom have. The first iPhone, I was in 5th grade. So I grew up with a lot more stimulation than my mom has ever seen. So that anxiety stems from not knowing how to sort out the real from fake, because the fake, like Dr. Ann said, the fake seems real to me because that's all I know.
And then I think it's instant gratification.
You said something powerful. Say the last thing you said again.
The fake seems real because that's all I know. So typing and emailing people, Snapchatting people, or tweeting, those are friends to me. It's not fake world like my mom sees. She's like, oh, why are you so into that interaction? I'm like, those are my friends, Mom. Like, she doesn't see them as real people because she didn't grow up with seeing those as friends.
And it's easy to hide behind those things.
Exactly.
Oh my God.
It's very easy to hide behind those things and present a facade that's, like you said, fake.
And
But
then,
it's
all
seems real.
filtered
Have to keep
interaction.
it up.
It seems real.
Like, how much pressure can it be? I can only
It's a lot of
imagine
pressure.
if a person, if let's say if I snapped a picture of me
Here.
8 months ago, right? And let's say I was at my best because I was in the gym, right? And then if I, 8 months go by and I look at it, I feel this pressure. Because people gonna look at me and see I don't look like that anymore.
That's what happened to me. I actually went viral on a picture I posted in a bikini, and I got 2 million interactions. ESPN retweeted it and everything.
Oh, wow.
Huh?
Yes.
Yeah.
It went crazy. My mom was freaking out because I couldn't leave my phone. I was freaking out. My phone actually turned off because of how viral it went on Twitter. After that, I gained weight because I got so sad from not getting that attention anymore. I was like, why do people not like my pictures like that anymore?
And that's addictive too.
It's addictive.
It is.
For real?
It is.
Yes.
I was able to meet
I ain't shouting nothing out in a minute, but I had to shout this out right here.
the people I was able to meet, the people who DM'd me. I was able to meet famous people because of just one tweet. And after that, I felt famous. I was like, oh, I'm cool. I'm this and that. And my mom was like, why are you acting this way? And I was like, those are real. Like, I was like, do you not see Tiana Taylor liking this? Do you not see her liking this?
Yeah, she did.
My mom didn't understand the obsession, but then she saw, okay, Anna sees these as real life people. This is her life. And so later on, I got sad because I was like, why are not people liking my pictures anymore like that? Why don't I have 2 million likes on everything? And it grew to an obsession.
That's
and then I
what I was saying, Anna, about being at the Las Vegas tables. That's the big hit. You see, you got the lottery win, and then after that, you're chasing that hit. So that's the addiction part of it. It's
Wow.
you put your money on the table and you got the ding, 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 ding. And Hugo will tell you, that's what you're chasing. You're putting it out there. You're putting your bet down, because when you get that win, makes it all so worth it. And that's the addictive part of the social media.
That's what I was going to say, is that, but then it's also, I think, for her generation, the instant gratification. It's
Instantaneous.
instant. So they're getting real time. For us, you get a new outfit, you had to wait to the first, till a certain day at
Come on
school.
That's me.
We had to wait to
But now we
show
have
off,
Fashion Nova.
Now y'all get
Instant
Fashion Nova
Amazon.
in 2 day or Amazon Prime.
Everything
show
is
your
instant for
outfit,
us.
the day of, and you're
Right.
getting that gratification. For us,
Right.
we had to wait for it, and
Yep.
then the timing had to be good.
Okay.
Couldn't be on Friday when
What?
your girlfriend was doing it. Could be
Mm-mm.
on Monday because it was a test day.
Don't take
Like,
a picture from here to here because I need to wear this again.
Correct.
Right.
Exactly. Look, then you had to have the press done after
Yeah.
church on Sunday. It was a whole deal for
That goes
us.
into dating too.
And
The
so-
instant gratification.
The instant gratification, meeting people, all of that.
Mhm.
Me and G5 had that conversation about courting and
don't
how
have that.
how you had to, sit on the phone in the kitchen with the long
Yeah.
string, with the
Right.
long cord around the
Go to
corner.
sleep.
Wrap it
Go to sleep on the
everybody
phone.
up.
Huh?
Now-
You sleep. You hang up. Hang up.
Now
Look,
someone can
look,
Uber you.
I just want to
across
hear
the
you
state.
breathe. Now
Right.
you can Uber to your
You can
dude.
Uber.
Yeah.
I mean, we couldn't do that.
That's right.
No,
you
it's
know?
actually a straight question. Smash or pass?
Yeah.
No, it's
Boom.
serious. It gets us.
It is.
But here's
Shout
another
out to
thing.
them, Luke.
That is-
Hugo just came out with it just like that.
Yeah.
No, but here's
Hugo
the thing.
said,
Like,
That's
look,
what it is.
but you
Hugo
want to
put
even
it out
talk
there.
about instant gratification. This is where even gambling, the most addictive form of gambling is video poker,
Oh,
because
my
it's so
Lord.
much more instant. It's not like a horse race where I'm betting, because I was a sports bettor, or horses. Same thing is that's why slot machine, you no longer are pulling anything. It's all
try to-
visual. It's
Yeah,
buzzing.
that's
true.
Because the casinos have learned everything in a casino has been studied. The pattern on the carpet is designed not to
that.
distract you. The drinks are coming in free because that's nothing. A free hotel room. All the noises, they know when you're walking in. The reason why those slot machines make all that noise, because it starts
Grabs
triggering
your
into your
attention.
brain. All of a sudden, you're almost like Pavlov's dog. Ding, 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 ding. And you start
Salivating.
going. Even if you're a sports bettor, you're
Yeah.
going, oh, I can feel
You're
it.
salivating.
You're
Yeah.
feeling the action.
Lucky
But I mean, but it's almost
Yes.
everything. So whether we're talking about sex, I mean, look, and I have my own personal IG where I post things on food. Everyone wants to know the best food, the best sexual experience, the best travel experience, the best. Oh, now of course now everything is around money. How to make money really fast in
Ooh.
seconds.
Mhm.
Everything
that's
is
right.
about. I want to do everything today.
Yeah.
Mm.
Now.
Yep.
Right
That's
now.
And
it.
it's that overstimulation, but overconsumption. Like you can be stimulated by anything and get that point. But the fact that I think they said the newer generation, because they're growing up with the ability to have iPads and know how to work that at
Right.
such a young age,
Right.
that their ability to consume and learn is happening so much faster. But because it's happening at that overstimulated
is.
rate, they're anticipating that there's about to be this new surge of ADHD diagnoses
Yeah.
because of, just that interaction. And Doctor, I don't know if you've seen an increase in that, but I saw so many people who were coming back and saying, and I think one of my youngest clients was 19.
Mm-hmm.
And he was like, well, I have ADHD and I have this, and I do cocaine and I do meth. Okay.
There's a lot of
Mhm.
numbers like that.
And so, and it's
Yeah.
just one of those, okay, I get it.
Man.
You don't know something else is scary?
It's trendy.
Men in their 20s now have the highest rate of ED.
Really?
I heard
the reason
this.
The reason is because they are viewing such hardcore pornographic
Yes.
images
Uh-huh.
and scenes at
Wow.
such an
Dang.
earlier age.
Dang.
Brian and I, we were lucky to get a Playboy
Man,
or a
please.
Hustler,
Right.
and
You want to
see
get
one
your
picture and you're
uncle's
like,
house to get to the
wow,
bathroom.
that's
So you
like
get
Keep
one
them in the
picture.
cabinet in the bathroom.
that uncle,
Now it's about
Hey.
now it's not even if it's a man on a woman just having sex. That's like so understimulated. It's got to be something. It's got to be choking. It's got to be.
I think that's why
the reason. And now they cannot even court, like you're saying, because now a normal interaction, if we and you meet and let's go get something to eat. Right. There's no stimulation. I cannot get excited.
I don't get it. Yeah, I don't get anything from you.
I will tell you, when I first moved here, that was actually my first job when I moved here in Sugar Land. I worked at a men's low testosterone clinic, and I was blown away by the number of 20-something-year-olds who are coming in there for treatment because of ED. And like you said, and I didn't equate it to that. And maybe because I was a female and they didn't want to share that was part of it. Some of it had to do also with medications that they were taking, marijuana, things like that they were being exposed to. But going back to Anna's point about the instant gratification, or like we were talking about the dating and things like that, I do think that it is the ease and the quickness of being able to get everything. And so that is easy to spill into what creates these addictive processes. And like you even said, Monique, when you were talking about young kids being stimulated with iPads and things like that, I have seen children have complete breakdowns when their phones are taken. Like if you take a phone away, and not even kids, adults who you take a phone away, or they can't get to it, or it's taken away or hidden and they can't find it, it is a literal adult breakdown that I have seen. Like almost really, even your son. But I mean, I'm talking about grown-ups can't go to the store, can't go around the corner.
That's
like
our method of payment.
That's
how I see it. I see my Apple Pay, my wallet's on there, my friends on there, all my secrets are on there, all my pictures are on there. So I feel like that security is my diary. I see it as like my little pocketbook is my phone. So if I lose it, then it feels like my whole world turned upside down, because that is my security blanket, is my online social media. It does help with my anxiety to a certain extent. But that phone, we've learned to use everything on there. Why did Apple put everything on there? To make everything easier. That is mostly for all of us to adapt, but it can be abused just like an addiction. And that's the bad part about it, is the overstimulation, the new apps surging, all of the new ways to like a picture, poke at someone, or get someone's attention. It's so easy to grab someone's attention nowadays, to where if someone yells at you across the street, you're like, he's weird. Like, why didn't he just follow me on Instagram? Like, like it's just like one of those things now where even a phone call is weird. Like, I'll be like, he didn't set up why did he didn't text me first? He's just calling me. Like it's just one of those things. Are you trying to collect debt? Why are you calling me? Like, it's just like weird now.
I won't ask for your number, but give me your IG.
Yeah, give me your IG. Yeah, exactly.
That's it. That is actually it. That is how a lot of people connect now. It is. Yes. It's like,
it's what's too personal giving a phone.
It's not your phone number. It's
So
what is your Instagram? What is your,
Right.
Giving a phone
But
number.
you talked about it being a security blanket, and that's that whole piece of I get to have interactions with a filter. I get to have interactions with a certain level of security to it, to where you get to say, oh, I'm sharing everything, but you don't really know this exact part about this situation.
And why.
I get to share the highlight reel, but I didn't show you what it took to set up this highlight reel and even have this happen.
I'm
talk about it. She does.
Dr.
She
Ann.
laughs at me about it. Oh, I know Dr. Ann.
Dr. Ann, what's your take on this?
I think the issue is to do with intimacy, and it's kind of like what I think it was Monique just said about, everything's through a filter. So one of the things I have to deal with my clients a lot is that really, their lack of real engagement is to do with anxiety. It's almost as if they become phobic of being in real connection with another human being. So they go through the steps of kind of pretending to themselves that they're in social interaction, and they're making meaningful connection, and they do it via social media, for example. But the reality is they're not being vulnerable, because vulnerability is about giving people the ability to build our trust. And how we do that is we ask them to, we tell them what our needs and wants are, so then they get the opportunity to reciprocate. So if often my clients struggle with things like being able to explicitly ask a partner, an intimate partner, for something simple like saying, I want to see you at the weekend, because I feel vulnerable, or I want to spend time with you. They'll frame it as things like, what are you doing at the weekend? So it gives them a step away from actually saying what I want and need. And the problem with that is they don't get to see how that person's going to respond, because the chances are that one thing the person could say is, I don't give a shit what you want to see me this weekend, I'm not coming. So that immediately lets them see how that person is, that this person's not going to meet my wants and needs. And that's high risk, because firstly they're going to have to be explicit about what they want and need, and that makes them very, very visible to that other person. But it also means they get to see what that other person is really like. Now, if that person turns around and says, yeah, darling, I want to see you this weekend, that's where trust really begins, because then we're in a conversation. I'm telling you what you want, you're meeting my needs, I get to trust that you're going to be there to meet my needs, and then we have a dialogue. But most, I would say, not if not all of my clients don't have that degree of intimacy, and social media allows a lot of us to pretend that we've got a big circle of friends, a big group of people that really care about us, but it is no human connection at all, because there is no trade in wants and needs, and we're not giving people the opportunity to reciprocate. Someone pick it, 10 seconds to like a picture, that's nothing. That's nothing. That's scrolling. That's not about, today I feel my mental health is making me feel vulnerable, I need support, can you come round and be with me? So until we get to the place where we can have those sorts of conversations with intimate others, then we're going to go round and round in circles.
Well, you know what's funny with her saying that for me? Oh, I'm sorry.
Oh, she said that's her take on it.
Oh, okay. I was going to say for me, I think it's the opposite. I'm able to be a little bit more bold if I get a slide in my DM. I'm able to kind of, say things differently through social media.
Okay, give me an example.
What do you mean?
No, I'm saying
no, because I don't know what she's talking about.
See, I must have me and her had the same mindset, because I don't get it.
No, I'm just saying, so it is easier for me for someone to, you get the standard good morning, beautiful. What are you doing, or can I see you kind of thing?
Right.
Or it is so much easier for me to be bold, I think, behind the screen than it is if somebody approaches.
It's harder
me.
for
That's
me.
what I mean.
It's a lot harder.
It's harder
for me.
on social media. See, for me, I don't have to have that interaction, because I can click unfollow and keep it moving.
No,
I can't unfollow if you're in my face. I feel more pressure.
But have you experienced someone actually obsessing and finding you?
Oh, shout out, mama! Hey, mama didn't want to put it out there on the streets. I hate to do this to you, Anna.
So I get scared to say no, because people are bold. So if someone's like, I need to see you,
right?
Where are you? Where are you located? Where do you live? Or stuff like that. Just trying to meet me, but it's in a way that I feel uncomfortable, because as soon as someone's like the typical, hey, how are you doing? Where are you from? I immediately stop talking to them.
See, she tells me that all the time. And
don't tell them where you're from or where you live.
She's always like, Mom, just don't reply.
Because I get scared, because it happened to me. I've been in so many situations where people are like,
so you had a stalker before?
I've had multiple people find me wherever I posted. So I learned not to post where I'm at that time. I've learned also to not follow people unless we have mutual followers. Or to only like pictures if I know them, because if I like certain people's pictures, they'll get too excited and try to find you.
Yeah, and and to that point, she's right. She has had people who, if she was hosting an event, who would show up at the event
and say,
not
hey,
like
you don't know me.
jump over the fence kind of stalk you. She hasn't had to that level, but definitely she's always like, Mom, can you just wait until we're done with the event to post? Don't do stuff in real
even
time.
Here, I had someone message me. They're like, "Where is this podcast?"
Oh,
I was
you
like,
good though. Here, shout out. Listen, let me get the cup out. Let me tell you one thing.
Right?
No, not the location, but
let them run up in.
Just in
Around the street.
I wish would.
I wish.
asking to just like
Dr. Ann is even
watch
safe
it.
right now in Spain. Ain't nobody gonna find her right now. They know she's up right now, but ain't nobody going to mess with her.
Absolutely.
'Cause I got my partners over there ready to go.
Yeah, but no, I mean, or when we post and some things you have to do promotional. So we were posting about the bike ride that's going to be this weekend. She got somebody who texts her, "You gonna be at the bike?" Both of us did. Both of us got, "Are you gonna be there?" kind of thing. And it's little things like that. And when she gets that, for me, my naive, me being naive about it, I'm like, "Girl, tell them to come on out with their bike." She's like, "Mom, come on now," But it's that generational thing sometimes for us as well. And so that's why I'm glad you actually brought her to be on the panel, because she is giving that different insight of these conversations that we have to have.
It's definitely, especially, and I know exactly what you're going through, trust me, because my daughter's an influencer. And so she went through this all through high school, undergrad, and even where she's at now. You know what I'm saying? So as far as everything you're saying about taking the pictures, and I didn't understand the content thing. And I still ask different people what they mean by it, what they do with it.
You can't,
Because she explains to me all the time. She said, "Nah, Dad." I said, "Well, I thought you went over here. Why didn't you put the pictures in where you?" She said,
"You can't.
I don't do that." But she told me about a couple things, but she know how I am. I'm crazy. So she ain't gonna tell me everything.
You got to filter it out.
Yeah, she know what to tell me, what not to tell me. Right? But about people though. About certain things and places that she went somewhere and the people were there.
Yeah.
Or, you know what I'm saying? Or if she did something, she would never do it by where she lived at.
Never.
But even look at today, look at this past year, just because part of it may be coming out of COVID, but part of it I think is also how many more just random mass shootings or single shootings are going around the whole country.
Right.
So you do have to be smart. You do have to rethink. And people are saying like, well, they didn't have anything in their background. Yeah, most people don't have a background until they do it.
Yep.
Right.
True.
And they're not usually going to therapy where a therapist will say, hey, and there's usually in a family environment where things will slip through the cracks and they will do these things. And that's the extreme thing. Shooting at a shopping mall or a mall or a grocery store. We're not talking about how many beautiful women get stalked by a bunch of just guys who just can't get a date. So they think, and somehow they fantasize that somehow because she liked a photo of mine,
that she
likes you. And that's why I'm saying there's a lot you can talk to a lot of beautiful women between the ages of 20 and 30 who realizes that they have to be very careful with a lot
how
of these
you dress
guys
in public too. Going to the mall. I have anxiety going to the mall with my mom. I'm like, hey, someone will know who I am. I'll wear baggy clothes and a hat. And she's like, why are you dressed like that? And I'm like, because I don't want to talk to people today. She's like, you don't have to talk to people today. Just don't talk. I'm like, no, people will find me, run up to me and say, hey, I saw you on TikTok. I saw you on Instagram. And I'm like, hi.
So does it make you like not want to do those things still? Like, because there is a trade-off.
It does. That's why I took a year off social media.
Okay.
I took a year off social media during 2020. That was the hardest year of my life. I took 365 days off. And my mom thought it was the craziest thing, but I was overwhelmed. I was overwhelmed with feeling like I needed that attention. I felt overwhelmed with people thinking that I needed to update them on everything I was doing in my life. I felt like it was just too much because other people, I felt like I wasn't doing enough. I was seeing people graduate with 10 degrees. It felt like I was like, I'm not doing enough. And I always felt like social media was toxic. I was like, what am I? I was like, I just don't like it. But it was because I was negative in my head. I saw it as all negative. So I was like, I need to get right. I was like, I don't know what I need to do, but I'm realizing that all my attention is on social media. So I took a year off. I was like, I need to refocus my mind. My mom thought it was just like, I was turning into like a really self-help guru. Like she
but
thought
I'm
it
gonna
was
tell
kind
you
of
why.
weird.
But this is why. And we had this conversation. I'm gonna go ahead and share is because you know how when you give yourself the opportunity for someone to miss you,
okay,
and you come back, her social media was worse than what it was before.
Are you
she
serious?
left. It was horrible.
Yeah.
And I'm saying that from the standpoint as a mom, because, so I do have my momager hat with her. And then I also have just being a mom. As a mom, it was horrible because the request to see her, the request
It was so
she
overwhelming.
posted one picture. And so it's kind of like, and I've even noticed, and some of us probably say, if you post a lot back to back to back, it doesn't get traction, but take a couple of days off and then post.
Right.
People start
they're right back on
commenting,
you, right.
right? And we can see that in our
They miss
everyday
you.
for us. Imagine her taking a year off out of everything
going
she was
viral.
doing after going viral, being at University of Houston, all of that. She comes back. Oh, Anna,
In a
where are you?
pandemic.
I had over
You
1,000
took a year
DMs.
off during a pandemic.
During a pandemic.
Mm.
So now you're coming,
People
you're
hated
entering
me.
back into that.
Yeah.
And it was such a double-edged sword because it was, yes,
It was
she's
love, but
getting
it was a
these
lot of
followers,
hate.
a lot of love, and it was a lot of hate.
People, my
It
close friends hated me
was.
because
It
I didn't
was.
update them with their birthdays. I wasn't saying happy birthday. I didn't like their picture when they had a baby.
Yes.
I
But
didn't.
they were serious.
They were seriously
Yeah,
mad
they
because
meant it.
we see social media as in I'm talking to you right now. If I'm saying hey through a DM, I'm
Right.
saying hey to you in person through our eyes. So when I ignore that hey, it seems like I ignoring you as a friend. It's not like I don't have all my friends' phone numbers. I don't have all my friends. We connect.
But she
in a
has all
different
their
way.
social media.
I have all their social media. That's how we connect.
Yeah.
So in multiple platforms.
On
with it.
multiple-
I'm telling you,
multiple
you're educating me.
platforms.
You are
That's
really
just
educating
how-
me on some stuff because
Yeah.
this is so good. I'm really glad you're here. I really am because one, we can get so caught up in our perspective of things. You understand why? And this is why I say my thing is this right here. I don't believe in the generational gap. What I'm saying is, for so many years, it's always been closed conversation between the generations.
It is.
And there's so much is lost. So the one thing, and this is what I appreciate about the military, is because the military is a young person's game. So no matter what, as you move up, you still are intact with the same young person that comes in.
That's right.
And because your position, you have to do the same thing they have to do.
That's
and
right.
they have to do the same thing. So there is no age thing. If we go run 10 miles, we all running 10 miles.
Correct.
We're not running 10 miles because of my age. You know what I'm saying? We're gonna run my pace. No, we're gonna run 10 miles. They ain't got a group on it.
Yeah.
So one thing they do is the generations stay together. You feel what I'm saying? So even by me being out, the thing I talk to everybody. I don't just talk to people my age. I talk to everybody. And then luckily I have kids that are stair-stepped in such a way that I can understand the generations. You know what I'm saying? And partly because I understood it just because one, I had soldiers at different ages, you know what I'm saying, throughout my years. And so, and I think, probably my mother's generation, that's the disconnect. We have the connect of, okay, Saturday morning, we knew the record was coming on and we cleaned the house. We knew that right there.
Yeah.
We knew that when the
Like
cookout
clockwork.
happened, y'all over
Kids
there,
go in one room,
y'all over there,
grown
you know what
folks
I'm saying?
over here.
Grown folks over here.
Yeah.
That happened. And it's not saying it doesn't happen now, but it's a communicative process. It's even like I seen on one of your posts, right? When your friends came.
Yeah.
Everybody, y'all was in there cooking, y'all was in there cooking, whatever. And no, I ain't stalking your stuff. I'm just saying I just saw the post. Okay. Because she was cooking. No, she was cooking. I said, shout out to them cooking in there. One of her little friends in there twerking. That's what I'm looking at.
Oh, okay.
I'm telling you the truth.
So
I saw somebody
now we
twerking,
know.
and
Now we
I
know.
think you called out.
I did.
You called out.
Yes.
Yeah, shout out to me checking out the twerk game. Okay. But
Gee, on the
but-
twerk.
Look, he checked that out.
my
I wasn't invited.
That's right. I saw some cooking going on. You know what I'm saying? I pulled up for the cooking. But the serious
Just
point,
took-
the serious point of this right here was what I saw was generations not breaking up. You know what I'm saying? Not, keeping it together.
Yeah.
And I think the more we get a hand on this and we stay communicating, you know what I'm saying, with whatever generation it is, I'm telling you, that's what will make us better. What's your thought on that, Dr. Ann? I sound like a little doctor up in here for a minute. Listen, you move over here like this. I might cross my leg. What do you think, Dr. Ann?
Yeah. I mean, I think you're definitely right, because what happens for me in a clinic is, each generation faces their own particular set of issues. They have their own particular set of generational challenges. And definitely for someone of Anna's generation, the use of social media is changing and redefining about, you know, how they perceive the social world and how they interact with intimacy. So, you know, you're saying that you feel bolder behind, you know, that gap where you can DM someone. Well, that's the issue, isn't it? Because, you know, that's not real connection. That's about being able to use that safety gap so that when we come out of that social media world where we are using filters, where we are using constructions to present ourselves in a particular way, and we're stripped back, that's when we've got the problem. I've got young clients who've spoken to me who have real issues with sexuality. Now, sexuality and being naked has always been an issue for a lot of people throughout, you know, all the generations. But now suddenly they've been bombarded with these images of perfect bodies, and the reality is that nobody's body's really that perfect. And you know, so and the self-talk becomes the idea of, how do I become sexually intimate? How do I do normal dating? How do I get past this addiction of like swiping left? How do I be able to start a normal conversation? So questions that previously we just wouldn't be asking because we didn't have the context in which that made any sense. Now it's becoming real significant issues. So these are the differences that I see in clinic when I'm talking to clients, because there weren't questions I had to ask. Okay, we had social anxiety. Okay, we had, you know, how do you date? But how the whole landscape has changed now, and with that brings a different set of demands and challenges for young people. And the only way for us to be able to appreciate it is to have conversations about it.
Right, Kenzie, what's your thoughts? And I'm saying, coming out there out of Greater Lake Charles area out there with the generational thing y'all got going on, because y'all deep.
We're pretty deep. With my mother.
Yeah, that's my boo. Shout out to Lake Charles all day.
With my mother, she believes that she and I should not do things together, like go on vacations and certain things of that nature. She thinks that that's weird, and she thinks that that's strange because I will always forever be the child and her, the elder or the adult. And so she doesn't feel as though we should do certain things together. That's always how it has been, and that's likely how it always will be. And so that's the way that she was raised. So that's what she knows. But for me, it's like, what's wrong with us going on a vacation? Like, I don't understand the difference. And she's like, well, no matter how old you get, I'm still the mama and you the child. And that's just the way it is. I mean, even though you're an adult, we don't do those types of things together. Isn't that strange?
You know,
I ain't gonna say it's strange now, because I ain't gonna say nothing against your mama now. I ain't about to do that.
And the interesting piece with that is, I remember growing up, my mom has always been the mom that everyone just, you know, could connect with. And, you know, she had a lot of folks, even my god sister's big sister, was just, you know, well, Auntie Tina, and it's just like automatically close, and almost use my mom as like this mentor, big sister role. And then I'm just like, you're going to talk to her about that? That's okay. So that's okay. Like, wait, you don't talk to me about that. Hey,
Exactly.
wait a minute.
Exactly.
Right. And so, you know, I remember at, you know, kind of in those teenage years to a certain extent being jealous of it, because it's just, well, how do you talk to them so easily about it? Or, you know, just open up and, you know, because my mom is just like big personality, you know, fun and free. And then it was just, yeah, I get some of that, but I'm not getting what she gets.
Right. And it used to piss me off.
Uh-huh.
It used to really, really anger me because I'm her only child. And so it used to upset me, like, I'm supposed to be your child. Why aren't I getting all of the attention? Or why aren't you giving me that level of attention? So that's something that I see a therapist as well. So that's something that I've had to work through, and just be understanding of the fact that it's different for her. She's from a different generation. So she views things much differently than I. She had different experiences. And so I just have to respect that. It is what it is.
You know, so I got the flip side. My mom was I mean, I would say growing up, I felt like we had a really good friendship, which is what you see why you see me and my daughter the way that we are, because that's how I was raised. But and both of my daughters, they tell me sometimes where I messed up is I feel like my mom had a clearer line than I did. Mine can be very gray.
Okay.
And what they hate is when I do that. It's still my house and I'm your mom, but yet and still
We crossed the boundary of being too close. So
they have told me that.
I don't see
Not
my
me.
mom as a mom. I see her as a close friend. There's a good and a bad thing about that. And we've already talked about this, is I respect her as a mom, but that respect can seem disrespectful in terms of her putting authority above us. So she'll say, hey, do this, do that. And I'm like,
we ain't supposed to be talking about our business, Anna. No, I'm just
but I will counter.
Shout out to putting it out there. I got a damn exclusive right now. I love exclusives.
because this is what we talking about, right? Like,
and
that's why I just said
too.
that.
That's right.
Yeah.
It's like, is she playing or she
I
not?
was joking, baby girl.
Should
Go
I have
ahead.
said that or not?
Right. Exactly. No,
Let's
you go ahead,
talk about
baby.
this on
No,
the
you're
ride
right.
home.
Let's do
Hey,
this.
damn,
But
Jada
basically
Jada
get
pick
it.
a Smith table.
Yeah,
Hey, right?
It's a 5
we
table.
do have
Till
the-
table talks.
We literally have a table talk to where she will sit me down and tell me about
Take it on that mic, Anna.
everything. Yeah. So I feel like that boundary being crossed is a good and bad thing. I feel like that's with every family. It's like, do you have boundaries with your family members or do you not? Are you too close to where you're like, oh my gosh, why are they telling me this much? Or is it so far to where you're like, what do they have going on? I can tell there's some tension, but I don't understand it. And I see that with different family members too. My little sister, I'm not as close as I am to my mom, which is weird. Usually it's sister, and then a mom.
Right.
But it's me, mom, me, and then my sister's like, oh, I'll just watch from afar. Like it's too
Y'all
much.
doing too much.
Yeah, y'all are doing too much.
That's a lot to take in.
It is. But I do
Can I
appreciate.
just jump in something?
Oh yes. Go ahead.
Jump on in there.
Yeah, no, it's just when she said, normally it's sisters and then mum. I just like to say, having years of experience, there is no standard family dynamic. Your dynamic in your family is what it is. So, how you relate to you or how you relate to your mum is as specific to every family as your fingerprints. And part of the thing is, I think we spend a lot of time trying to reach or attain what we perceive is the perfect model. And we beat ourselves up when our model isn't the same as what we perceive as, this is the way to do it, this is the norm, when there just isn't one.
And that's true.
See, Dr. Ann, see you up past his regular time.
The doggy's like, no.
The dog, what's your dog name again?
My dog's called Beth. So she's at my door. I've got a gas bottle trying to stop her from getting into my office, because normally when I'm working with clients, I've got 2 dogs and 2 cats. So
Right.
there's a parade of them raiding my office. So all my clients get used to my moments of complete lack of professionalism where I'm kind of fighting animals.
I need Dr. Ann as my therapist.
I know that's right.
Me too.
I might have to sign
Where do
up
I
for you
sign
talking
up?
to me. You know what I'm saying?
Sounds like my kind of session.
I might be on your website.
Right.
Trying to be too professional, to be honest. I've given up trying to be too professional because I've found that life gets in the way.
Hey, life is out there. Hugo, what's your take on it, man?
It is.
Well, when you were talking, when Anna and Brandy were talking, it just reminded me, I've seen this before, either in real life or on social media, where it's almost scary when I see like a mother go, well, my child's now old enough and we can go drinking and bar hopping together. And I'm like, so that's a little bit odd if we're going to then start pick up guys.
She's like, what's the play? What's the cool thing to do today? I'm like, what is her favorite? Like, I'm
your
cool
wingman.
mom.
You're my wingman. You're young. Come on. You got to be able to bring in some kind of energy. Am I looking And then this way, Brandy could be like, "Am I going to be the cougar tonight, or am I looking for sugar daddy? Help me!"
Oh
my God.
No, but what I'm saying is like she's like Dr. N is saying, the family dynamics really, like in my family, it was always the men were watching sports and drinking, and the women were in the kitchen. I grew up in a Hispanic household. That's how it was. My mother and my aunt were always the cooks. And we went to one house or the other. They were in charge, and then the other one would do, the other side stuff. And that's how I just grew up in an environment. We're going to watch sports and we're going to drink.
Well, let me ask.
That's the fine. And so, like I said, that's the dynamic.
Do you think? And I'll ask this to the two men, and I would like your perspective on this.
Okay, go ahead, get mine.
Do you feel like? And I know this may be hard to answer completely without knowing the true dynamic, but in my mind, I do feel like the dynamic would be different if there was a man in the home.
You want to go first? Because I got mine.
As far as the relationship that I had, like this dynamic, that it would be maybe a different kind of structure or order, because I was raised in a single parent home as well. So that was the relationship that I had with my mom, where we were so close because of, it was kind of like she's mom and dad, she's taking care of everything. She's holding it down. So yeah, she was mom, dad, best friend, because I didn't have, me and my sister growing up, we didn't have in the home, we did have male figures, but in the home, that same thing. So me coming out of being married for 20 years and then being in this new phase of my life with my girls, and a little bit of backstory. I got married at 19.
Never dated before.
So dating and all of that is new to me. And so I know wholeheartedly that a lot of times I'm living vicariously through my daughters. I know that.
She's like, don't get married. Just wait.
So that's my narrative to them now. It's like, live your best life, girlfriend, because when I was your age, I was pregnant with you. So, we're seeing things different.
It's not a good, I feel like that scares me, because like the pill thing that he said with saying you're going to choke, basically by saying you're going to choke with getting pregnant early, scares me because of her experiences. She's like, oh, don't get trapped. Don't get pregnant. I'm like, okay, but everyone else is starting a family. And I feel like me waiting is a fear of what my mom went through with getting married to you.
Oh, that passing that generational fear thing.
Yeah.
It's
generational. Even though it might be good advice,
yeah,
but it's still from the way she's taking it and receiving it.
Yeah.
It's like, hey, you know what? Hey, that was your fear. It's kind of like some parents.
Absolutely.
I don't let my kids fly because I'm scared to fly.
Yeah.
So my kids don't fly. You know what I'm saying?
Yeah.
And
right. I don't swim.
Right. Yeah.
And so many kids don't know how to swim because their parents don't know how to swim. Mm-hmm. And you asking the kid, you're like, hey, we're going to the beach. You grown people, you're like, hey man, we about to go to the beach. They're like,
I can't swim.
I can't swim. You can't swim.
All right, go out and let me know where it drop off.
I'm like, you can't swim. Nah, man, my parents gonna swim. That's the first thing they said. No, my parents gonna swim. And I'm like, what?
Yeah.
I don't know if my mom can swim or not.
Right.
Guess what? Shout out to me for swimming. My swim game is strong. I'm a swim on. I don't care. I almost died one time, but I was swimming though. You know what I'm saying?
Yeah.
Because I'm hard.
Yeah. So you gonna answer the question? Man?
Yeah. You know what? And I'm saying because I have girls.
Uh-huh.
I do think it could be different. I really do.
Yeah.
And I don't think it would one, because some of the outlet that you have would be taken up and you wouldn't for the things, you know what I'm saying, that you go do with your daughters. That probably wouldn't happen. Then probably the connection with the man would be different, you know what I'm saying, with your daughters. You know what I'm saying? And because I know it can be an influence one way or another. It can be an influence, whether it's good or bad. It can be influence, you know what I'm saying?
Right.
And so and I'm just speaking from just me and what I think.
But I will just say, for me, I wouldn't trade it for anything in the world, because we can talk about
anything,
and it's
even though she cringe sometimes. You can talk about
even though she cringe, I cringe. I be like, oh, clutch my pearls, and they ain't even AK.
So let me ask you this right here, this dynamic. So if you see your mother wearing a shirt that says, I'm a hot.
Oh my
mama.
gosh, those are so embarrassing.
Shout out, I know Wills because I saw her with a shirt on. I said, I bet her daughter's probably said something.
No, we say something every single time. She's a
It's
keep it
a
real.
retired hot girl.
Listen.
Okay,
Don't-
I'm a
listen.
retired hot girl.
Those
And
are
she's
so
not a retired
embarrassing.
hot girl. She's hot right now. Shout out to Bree.
Hello, shout out.
Kids done started pushing that button. Kids done
That's why we
started.
need you right there.
Yeah,
Right there.
Thank you for my
But
You're
shout
welcome.
out.
see, that could be some psychological warfare on your kids.
It is.
You know what I'm saying?
Or even her taking pictures. She's like, take a picture of me. But it's 10 times more pictures. Like we take pictures normal. Like
Right.
normal people were like, oh,
But-
okay, cool.
yeah.
That's it.
What she do?
She'll take 10 every single time.
In all fairness, your
Brandon,
generation
Jimmy.
taught us how to do that.
Thank
Okay.
you.
Y'all
Thank
just well,
you.
hold on.
Agree.
No, wait a minute. Hold on. I have to hit
Thank
the
you.
angle,
Lighting,
yeah.
pose,
Lighting.
prop, and
Pop.
pose again.
Yeah.
Now, like,
And
I
I-
mean,
and I-
I had to learn from Gen Z, and it was just
I do
So
see
that's what
more.
it's supposed to
I,
be
I
doing?
do see
Right.
more mothers on TikTok than
I do.
the kids on it now.
Now it's
because
Mother's
they are
Day.
entertaining.
TikTok is my favorite. Follow me on TikTok. It's Anna Perry.
They are in.
Okay, no, here's another dynamic. Okay, and I did this by accident. I'm gonna tell you what happened, right? So you had started following the page, right? So I'll look, you know, what I'm saying? I don't follow everybody, but anyway, so I'll look, and I like, look that I click on the thing, right? And so I'll just scroll down and I look. But sometimes your finger can touch stuff,
And you're liking stuff.
and you're liking it. And I like one of her pictures. And I unlike that thing so fast. I'm like,
No.
I saw the heart pop up. I was like, oh no.
I have so many friends who will say, they'll be like, I saw little Anna. I'm like, gosh, she's almost 23. But
But,
like,
but it's still. But I
you're
was
right. I
look
get
at
a
the picture like that. I was just doing this. I was just doing that, and my finger hit the heart out, and I'm like, oh shoot, I shouldn't be heart on her daughter
did a skip on the screen.
because I didn't even
But it
mean the
doesn't
heart.
mean a heart.
It's
so
Oh, that's so
Listen.
funny. But you're
Those are
right.
funny.
You're right. It is
I have to
so
look at
funny.
it because one of my friends when they I can see who like my daughter's stuff, right?
Yeah,
And you know some stuff like some of her I only look at
yeah.
like
yeah.
some of them like she was on the beach just recently, and I scrolled right on past that thing. Well, she had like 3 photos on there, but I ain't looking
I
all 3
scroll-
of
you
them.
scroll past.
Let me go on.
Fast scroll, huh?
I can't do that. You know what I'm saying? But that becomes some pressure.
It does.
That's pressure. I did,
A whole nother conversation is of family
Mhm. Yeah, 'cause you
thinking
got-
that they have control over your social media or that they have a say-so
Ooh.
with your social media.
right.
That, especially at a certain age, it's all on you. It's
Right.
your social media. And I feel like that's your outlet.
Okay.
That's how I see it. But I know there's parentals. What is it? I don't want to say
Parental
control.
controls.
Or
There's
Guidance.
guidance, but that's a whole nother conversation. I can't even get there.
You know what I'm saying? Well, let me do this right here, and I'll say because we're at the 2 hours and 21 minute mark, and right now
Thank you.
it's at 7. It's at 2, 3, 4, 7.
Yeah,
One,
Dr.
two.
I better
Ann.
say you
Yeah,
count
so
it.
it's
Look, and then we
it's-
gonna want her on Houston. Wake up,
Yeah.
right?
Right.
Houston, wake up in the
She
morning.
can be on Houston laid up.
Right.
Okay, I'm here with y'all. So this is what I'm gonna do. I always go through the room. So I want to start with you, Dr. Ann. 2 things I have for you. One, what did you think of this happening tonight? And also, what did you learn?
I really enjoyed the conversation because it's always really nice to have the opportunity to have, like hear different perspectives, because a lot of the time I'm kind of limited in my opportunity to speak with different professionals. So it's really interesting to hear from primary care providers, addiction specialists, being able to hear from Kenzie and her speech and language stuff, because that's always really interesting when she's talking about autism, ADHD, and the speech pathology. Fantastic to hear from somebody who's gone through the process of addictions, because someone who's got that internal perspective and is able to talk about it articulately and after they've gone through the process is always a fantastic learning experience for any therapist. But what I would say I really enjoyed was listening to Anna's perspective, because it gives me an opportunity
We got to give Anna a shout out.
Thank you.
to actually hear what the reality is because I'm 48. I'm not generation who's social media savvy. It isn't meaningful to me, but it certainly is for younger people. So any opportunity to be able to hear those voices and get that perspective is always for me incredibly valuable for when I work with other clients. So I say thank you to each and every one of you for being able to give me some insight into what you do and how you see the world. Thank you very much. Oh, and thank you to you, G, for letting me be here. It's now 5 a.m.
Shout out to me.
Shout out to you. Let's give him a
Come on, Kizzy. Hit that.
Shout out to me. Shout out to me because Dr. Ann said a shout out to me and she appreciated everything.
Look at that. That was the first shout out to me this whole time. I'm proud of you.
I know. I usually get about 3 or 4.
Right.
You know what I'm saying? I'm trying to beat Snoop record.
Look at that.
Oh, what were you saying, Dr. Ann? I'm sorry.
No, that was me. That's me. I'm just complaining about the time and the fact I never got any food.
wow.
Do you have DoorDash in Spain right now? I really appreciate you. You know what I'm saying? Just for the fact that when I asked you.
Also, can I just thank you to Kenzie's son? He's adorable. He's totally
Shout out to
him. You know what I'm saying? I'm sorry, Kenzie. I'm sorry. Listen, boy, Kenzie be on the button.
I made him, so let me
go ahead and shout him out with. Good. Shut up, Nicky. Big Nick. Big Nick in the building. He got his Avengers magazine over there. He doing it big.
Yes.
I need a shout out. My mama's on YouTube.
Who, Mama Tap?
Mama Tap.
You don't act like I ain't seen Mama Tap come through. Listen, I don't play. Mama Tap done came in. I know Mama Tap.
She see her baby namesake on there.
She see me on the camera. Mama Tap, you see me on the camera.
She ready.
You know what it is.
That's what she see, girl. That don't make me come out there.
Leave my mama alone.
Listen, I be all out there. Girl, don't make me come on them highways about there. Out there, I get out there. You know what I'm saying? but back to you, Dr. Ann. I really appreciate you so much. Just for even just, when I asked you, you like with no qualms about it. You like, hey, because the first I asked you, I say, what time would it be? So you told me, and they like no. So I appreciate you. It shows me that you love what you do. One, you're over your plus 30 years of doing this in the business and just really being good at what you do. I'm telling you, put some good insights down there. So that I'm gonna take some things that you that said that I probably can make some t-shirts out of, but I can learn from it as well. And I did learn from it tonight because you made some things just really, you said it in a simple way like that. That was simple. And I never really thought about it that way. So I really appreciate your expertise shows. Okay. So this
thank you very much. I appreciate the compliment.
No problem. Let's give my man Hugo V. You got to put a V. You can't just say Hugo.
Yes.
I learned because he'll correct you in a minute. He'll be like Hugo V.
Life
is wonderful.
And the beautiful thing is the website is lifeiswonderful.love.
Oh, right.
Because that's what we're doing. We're pushing some love, man.
Ooh, shout out to love. Everybody need to get love out here.
He probably got that little P. Diddy spin on it, don't he?
His name. So you the original love.
You the original.
Original.
He the OG.
Ooh, the dot love.
See, what I actually do like about this is that I was one of the early guys on the podcast. I think I was podcast number 9.
Oh, were you?
Yeah, I was back here. This was the Friday before
single digits.
Yeah, that was like this was the Friday. This was the Friday before the freeze. That's how I know how because it started getting cold outside.
Oh, is that why you brought the jacket?
Yeah.
Just like somebody.
Yeah. Oh. No, but so we were called. She was like, "Yeah, I want to." Yeah, we were talking about bring you back on and all this, and then I said, well, why don't we do something a little different? We were kind of brainstorming. So let's just bring in more. Instead of just bringing me back on for 2.0 like he's done with some other people, I thought I've seen when he's brought in like dual people. I said, well, let's do a round table. And
you don't take credit for it. You ain't saying a round table. You say it was somebody else. You ain't about to take all the credit.
I didn't say. I said we brainstormed. See, Brian doesn't listen. So you notice how Brian doesn't listen? I said we brainstormed, and then all of a sudden he heard Hugo's taking all the credit, so I'm going to step in. His insecurities are coming in.
Oh,
shout out to me being insecure. I shout stuff out.
Not the end of podcast assessment.
Exactly.
In the podcast diagnosis.
I deal with acceptance very well.
No, but I just like the ability to just bring in different perspectives, and I like when you told me who was kind of coming on, that it was going to be a good panel, a lot of different experiences, obviously different ways of teaching, to come and have a good conversation.
Yeah.
Because then, to me, I'm always open to have conversations with different audiences, because the only way we're going to get better is having conversations on whatever the topic is.
Right. True.
Right.
And especially mental health, and to talk about anxiety, depression, suicidal thoughts, but also talk about all the good stuff, what I always call the good stuff.
Right.
Let's talk about gratitude. Let's talk about spirituality.
Definitely.
Let's talk about emotional vulnerability. Let's talk about all that, because the more we talk about it, the more we take out the stigma. Like you said, let's take away. Stop being afraid to say, I go to a 12-step meeting.
Right.
It should be celebrated that people are seeking help.
Definitely.
Because you don't go to someone going like, why did you go to the doctor when you saw that weird mole on your skin? Because I wanted to check it out to find out was it nothing? Was it cancer? Was it whatever? And also take out the stigma of just seeking help.
Right.
Stop. This is my main thing. This is what I say. Stop assuming asking for help is something negative. Asking for help is a sign of strength.
All day.
And until we keep saying that from all different generations, ask for help. Because you know what? No one has all the answers. And if your ego is that big and you think you have the answers, or you think that someone's going to think something differently of you, no, I'm here to tell you, I've gotten so much more peace in my life because I've actually sought out help.
Awesome. Well, thank you I wanted to say thank you for sharing and being so transparent. Because I don't think there's probably somebody who's going to hear this and hear someone who is so open and honest, and hopefully reach out and say, I can put a face with a name and help me with my addiction or whatever I'm struggling with, or even Dr. Ann and what she talks about. And, when she opens up about what she helps with hypnotherapy and things like that, because these are things that we're moving to that can sometimes be looked at as taboo. And we're all of us here, we're breaking that mold. What you're doing with autism and, speech pathology and helping out on that end. Those are things that we don't talk about. You got a child who isn't speaking correctly or speaking right or won't speak at all. And we look at that as, it's the milk, or what did you do wrong? Yes, because they was on that cow's milk, or, like you get all of these other reasons.
But even pushing things like get a hearing test, some simple like that. Kenzie's stuff is, and that's beautiful.
Absolutely. So I want to thank you guys for that, because this right here, like you guys said, doing the one-on-one is great when he digs into your past, but to be able to talk about moving towards the future, what we can start doing to break some of these generational curses and cycles and things like that is just so. Thank you, G5.
Shout out for Brandon just jumping in there without messing rotation up. She wasn't even next, but that's what she be doing. She coming in major Brandon just came in and took over again. You know what I'm saying? Look, she took my buttons.
I like it.
Well, we know you do. Shout out to Monique. She gonna be the one. You ain't gonna get nothing trouble. 100%. She been team girl since she landed. Trust me. The first time I invited her over, I said, "No, just come on through." She came, G, and this. I was like, "Oh Lord."
I didn't even ask to be.
I asked her to be here.
That scene.
I asked to be. I gave a mic right to her.
This is the first one you told me, like, no, you'll have a mic this time. Just slide across the table. What? Okay.
But as I continue to go around the room in the order I was going in before I was rudely interrupted, because I was trying to go to Anna next. Because Anna, you really made the show. I'm being honest with you. You made the show.
All right, Anna.
Listen, I don't know if we can do it without you. We'd have done it. We would have done it like this.
Oh, shout out to Mama.
Shout out to Mama.
Shout out to Mama.
She had to come back and get on singing again. Look, Monique ready to. Anyway.
I'm just
ready to support.
I can't reach the button.
Girl.
We lucky.
But so I'm gonna go to you. So two things. Was tonight important? period for the topic, and then what did you learn tonight?
The first question was, I'm sorry.
Was it good tonight?
Oh,
you're
yes.
saying for the topic.
Yes, the topic I feel like was needed for even me to hear that I need to probably just take a step back and realize that I need to sort my own thoughts before I run to any type of platform. And I am learning that. I did apply that, and I am still applying that, but I always need that reminder, and this definitely reminded me. I can also teach others because I feel like that's what I want to use my platform for now. I have a lot of people following me. I have about over, I would say altogether with all my platforms, 50K people who follow me. So 50,000 people watching what I do, if it's actively or not actively, they're at least seeing what I post, and the things that I post should at least impact in some kind of way. And I feel like this has helped me take a step back and realize that there's others watching that I don't even realize, who aren't liking the pictures, who aren't really interacting, who are just the watchers, like I say, the ghost followers. But this taught me a lot, and I feel like it was really good, and I feel grateful that I was able to share what I've been through or what I've learned through social media, or not just social media, just through relationships with my generation. So yeah, that's pretty much it.
And that's what I'm talking about. Listen, boy, everybody listening, that's serious. You know I'm gonna go down here to that back left corner down there. Monique, what's up, girl? So I got her. So
I was like,
tonight,
okay.
do you feel tonight the topic was important? And what did you learn tonight?
I always feel like this topic is important. I always feel like it's necessary. I don't think we can ever talk enough about your mental health, what that means, and the ability to have self-awareness and self-assessment, and not only just have those things, but to apply it. And so I love the fact that Anna was here, just, to, kind of one of my things.
Shout out to Anna again. She didn't get them damn shout outs tonight.
Yes.
Listen, your damn shout out view count gonna be up. I tell you that. We're gonna overshout you here.
I love it. I mean, because like I said, I was the clinician who didn't want to be one. So my moments of like just joy come in sort of those watching things connect.
Right.
And watching that, okay, I didn't consider that. Or that's a different way to apply it. And even as Dr. Ann was talking about, just reframes. So I love just the different perspectives. And I always love hearing from, the folks in the field who I tell people, I don't like cracking people open. I don't like it. I enjoy, like, let's build back up.
Okay.
And, to hear, so many people and to hear all of the different experiences of how much everyone just enjoys what it is that they do.
Right.
And, the importance of having, more than just what it is, your modality at the table. And just hearing it consistently. I love those conversations because people think that it doesn't happen. People think that there is no intersection between, physical health and mental health and your emotional well-being. But there's such that strong connection. And I love just, that even the audience was able to see how that gets done and why it's important in maintaining everything. So I absolutely love it every single time.
And what did you learn tonight?
What did I learn tonight?
Yeah, you didn't fly by that right there.
One of the biggest things I've learned is I never see what it looks like from the physical health side, and that there is so much consideration taken because, there's always the rule out criteria when it comes to making diagnoses for folks. You have to be able to say that this doesn't relate back to a physical issue. So there have been plenty of times I send clients and it's just like, you need to go get that looked at because it may look like depression, but it's not yet. So it was good to hear what it looks like from well, this may look like depression, but actually this is, or this may look like this physical ailment, but actually you're dealing with depression. So it's that, I think that was the biggest takeaway for me, just hearing it processed from the other side.
And then shout out to them processes. She heard it from the other side, dark side, light side.
All the sides.
You know what I'm saying? All the sides. No biscuits on it. No biscuits. Okay, we're going to the yellow outfit gang over here. You know what I'm saying? Shout out to pink, yellow, and green, and all the other colors. She done brought a another color into the organization. That's what she did. Listen, I thought she came in with some pink or something on, but she gonna come in with some yellow. I don't know who yellow is, but go ahead. Listen. Okay, something happened to your mic. What's going on? Wow.
Oh, I don't know.
Oh, there you go. She cut you. Shout out to Anna, just cut off.
Woo!
She just cut you.
She replenished it. She replenished it.
Anna dropped the mic. She said she's dropping it for you too. You ain't gonna say that no more.
She replenished it. Thanks.
Yeah.
But I just want to say thank you for having this platform and the different perspectives that we were all able to bring to the subject the subject matter at hand. Mm-hmm. It was very, very interesting to hear from Dr. Ann, Monique, Anna, Brandy, and Hugo as far as all of the different topics that we spoke about tonight, from addiction to the generational differences to social media to just socialization in as a whole. And one thing that I really did learn tonight that was interesting that I could probably connect to my profession in autism was from Anna, because give her some. She's yellow button worthy.
Wait, listen, I thought you gonna listen. When you talking, I'm scared to push the button. You see, I pushed the button. You get a little attitude. Like I should have pushed that.
That was because of that little monster over there. Sure. But I just want to say that thank you, Anna, because a lot of the perspectives and insight that you gave as far as the difference in the generations and how your generation views social media and how much it does for you internally, emotionally, mentally, it gives me a different perspective to connect to autism and those who are in your generation with autism, having to deal with not only the social emotional disorder that autism is in itself, but then also adding the social media realm on top of that. As a professional, that is not something that I've ever really taken into consideration. Right. And I think that ties back into, because of with my generation, we always look at that as, well, social media is a crutch. You know, it's not something that we understand, but it's never been explained to me in a way that was so specific in the way that you have. And so I really do appreciate you taking the time for that, because now I see a whole different population out there that could use my services that I haven't been able to understand previously. So that was a huge, huge factor that I learned tonight. And that's why I'm over here shaking my head, barely saying anything, because I'm like, that connection. Like, okay, now I got it. And so I'm over here like connecting the dots in my brain, like, oh, well, what about somebody who doesn't have those things to begin with and is undergoing that at the same time? Like, that must be terrible. That must be detrimental. So thank you for that, because that really did help me. So thank you.
When she look at me, I got to push the button. I had to wait and watch that. You know what I'm saying? What? Libra said, you don't get the Kenzie cue. Something wrong. Shoot, Kenzie gonna give them live. Look, you know, I think you push the button.
Yellow what?
You know what I'm saying? I told you to push that damn button. Give it out to Mr. Terry. Hold on, you gotta talk on the mic. You gotta tell him on the mic.
Okay, Terry. He said, did I bring anything of substance to the conversation?
And you know this, man.
Absolutely.
Yes, you did. Can we get a shout out to
shout out to Terry? Can he have two yellow buttons? Can he have two yellow buttons?
We get another yellow.
Listen, I think Kenzie's been on the show more than anybody.
Right there with you.
Kenzie has been on the show more than anybody.
Sounds like co-host.
I think she's been more than Jay.
Right. You know no, I didn't. I was not more.
You on the street. You on the street now. Jay will be over here. June 11th. Y'all better check Jay out on June 11th. She got a mastermind class. She's gonna do it over here. And so, you know, big thing. You can go register on her website for the mastermind class with Jay Rich Trucking. Go check her out. Make sure you do that.
But don't bypass what Brandy just said.
We're not bypassing what Brandy
She said it
now.
sounds like a co-host
I did say
situation.
that.
But you already know the situation. Your situation though.
Don't try to
That's
bypass. You're still bypassing what the lady said.
Listen, she got her own thing. She got her own solo.
Yes. Topic maintenance here. Come on.
She got her whole thing,
Okay.
and she's scared to go do it.
I ain't scared.
You scared to go do that whole thing?
I'm not scared of anything.
She's in the planning process.
What
Monique,
she said.
quit, Monique.
I think
Monique will always do that. It don't matter. She go, that's right, girl. Girl power.
What she said.
She could be straight wrong. But that's right, girl. I got your back.
I think what she's trying to say is that it needs to be a transition, co-host to host.
Oh,
You don't just go from
I did it.
A to Z.
I did it. She better than me.
Shout out to G5.
Shout out to me
That's
for
G5.
again.
Yellow
Shout out to me. Because I just jumped on this thing and I ain't know what the hell I was doing. I still don't, but I have a good time. Because it's fun. Like I said, every day it's fun.
I can't. I know.
Who's
I couldn't tell. No shade like that.
Shout out to Brandon for
Yeah,
starting drama.
You
Brandon with
gonna
his
fire me
drama
already?
Okay, hey, listen, everybody. I really appreciate y'all. I got Dr. Ann
Amazing.
over here in Spain.
She gotta go night night.
She
So
got-
sorry, Dr.
I know.
Ann. Yay. Thank you,
she-
Dr. Ann.
She ain't going night night. She gonna go day day.
Oh,
Because the sun about to come up over there.
oh no.
Get some rest,
So-
Dr. Ann.
So, Dr. Ann, once again, I really appreciate you. I
Yeah, I'm
appreciate you.
gonna try and get a couple of hours.
Yeah, go and get some. You probably have some patience today too, right?
Yeah.
Oh man.
Well, actually, today,
Okay.
thankfully, no.
We
I've
enjoyed you
got to
though.
drive for 4 hours though.
Oh man.
Okay.
Okay. Well, let me
4
get
hour
you on off
drive.
here. Man.
So that's not going to be great.
Oh man. Well, you be safe. Make sure you
Be safe.
take.
Please
Can you
be
do me a
safe.
favor? Take a picture for me today, and just when you post it, say this is a picture for 5Cast. I really appreciate that.
Oh,
If you do that for me,
I'm
Okay.
safe.
of that beautiful scenery.
Yes.
Okay, you want a picture
Oh.
of Spain? I tell you what I'll do. I'll go down and I'll take one of the sea, especially for you.
I appreciate
Aw.
that. I appreciate. Shout out for me again. I just got me a picture. Y'all better stop. I'm international. I ain't got time to play. I'm getting pictures sent in. Listen, I'm international. I ain't got time to play with y'all. Y'all better
Right.
know. Hey, I
why
want
you
to say
the
good night
host.
to everybody. Thank you so much. I was gonna have a show tomorrow, but Chef Shay, she had a double booking, so we just went on and we're gonna save it for later. But so next week though, I got some bangers for you next week. I got some surprises for you next week. So much surprise, I ain't even gonna say nothing about it.
Oh.
But I got some surprises for y'all next week. When I tell you, you're gonna want to tune in next week, and you're gonna be totally surprised. But if you ain't got nothing to do, you know what I'm saying, just make sure you tell everybody in your family you love them, tell your friends you love them, and just reach out to somebody you haven't reached out to in a long time. I guarantee you they'll be happy to hear from you. So we're gonna go out without any music tonight, because one, I'm using my other box. The other box is right here, the one with my look, I don't play. Shout out to me. You know what I'm saying?
One more time.
I plugged the wrong one in today. So, that's me. I plugged the wrong one in, so that's why we don't have the music. But
All right.
but they got some music coming in the box. I can go out with that music. Let me see.
Okay.
Let me see if I like it.
I see where we're going with that.
Hey, thank y'all.
Hopefully that'll wake you up, Dr. Ann.
Yeah, we're going out with that music.
Bye.
No.
Hey, I appreciate y'all. I'll see y'all next week. Have a good time.
Thank you.
Bye, Dr. Ann.